Anita is not coming. Anita is not coming. Also, Somnath is not coming.
This discussion will focus on strengthening healthcare systems through policy reforms, positioning India as a global finding patient care with smart hospitals and technology-driven solutions. We will also highlight the expanding role of nursing in leadership and workforce development, ensuring that healthcare remains inclusive, efficient, and patient centric. With expert driven insights and forward thinking strategies, today's session aims to pave the way for a more resilient, accessible, and technology enabled healthcare ecosystem. This conference would not have been possible without the invaluable support of our esteemed partners who have played a crucial role in bringing this vision to life. We extend our heartfelt gratitude to our session partner, Graphic Era Institute of Medical Science, associate partners, SUT Pattam Hospital, Trivandrum, Kriya Medical Technologies, academic partners, KR Mangalam University, Lovely Professional University, supporting partners, AMED, and UN Global Compact Network India, startup partner, Gazelle Hemex, contribution partner, Transasia, and knowledge partner, Frost and Sullivan, for their unwavering commitment to advancing healthcare. Their contribution are shaping the future of industry and we truly appreciate their support. Now, before we dive into our power-packed agenda, let's take a moment to celebrate the incredible journey of Voice of Healthcare. So let's watch this short video highlighting our milestone and impact. Thank you so much, and let's give a round of applause for this amazing work which Voice of Healthcare is doing. So, without any further ado, let's commence ninth International Healthcare Conference 2025. But before we dive into our power pack session, we have something fun, engaging, and interactive sessions lined up for you all. So we are thrilled to have an incredible audience who have traveled just to be part of this insightful session. And to make this experience even more exciting, we are introducing a special audience quiz round. So we'll be asking a series of fun and insightful healthcare related questions throughout the day. Each question will have four options, and those who know the answer must raise their hands to respond. And our team will be tracking the responses to recognize the most active participant from the session. And at the end of the conference, we will be recognizing five outstanding participants based on most active participation, most correct answers, fastest responder, and most active on social media. So what you have to do is you have to post about this session or how was the key takeaways and what your thoughts about the session on LinkedIn, tagging Voice of Healthcare, and our team will be analyzing all these things at our backend. And based on that, we'll be distributing some amazing gifts. So to start with, I'll just give you how it will go. My first question would be, which of the following has been officially eradicated worldwide? A. Smallpox. B. Polio. C. Tuberculosis. D. Malaria. I hope everyone would know answer of this. Yes, the right answer
Smallpox.
is polio. So, okay, ma'am, you're wrong here. Any more I think this is very simple, and we could have more hands. Smallpox. So World Health Organization announced smallpox eradication in 1980. So that's the correct answer. So this is just the beginning. We will be conducting these quiz rounds before and after each session to keep energy high and make learning more interactive. Thank you all. Now, to officially commence this prestigious conference, we begin with our inaugural session, setting the stage for insightful discussion that will unfold throughout the day. Now, I would kindly request our esteemed dignitaries to come forward. Dr. Naveen Nishal, serial entrepreneur and founding chairman, Voice of Healthcare, for welcome address. His Excellency Boshan Gair, representative, Taipei Economic and Cultural Center in India. Let's welcome them with a round of applause, guys. His Excellency Dato Muzaffar Shah Mustafa, the High Commissioner of Malaysia, Major General Professor Dr. Atul Kotwal, Executive Director, National Health System Resources Center, Shri K.R. Chawla, Deputy Drug Controller, Department of Drug Control, Government of Delhi, Mr. Rajiv Nath, Managing Director, Hindustan Syringes and Medical Devices Limited and Forum Coordinator, AMED, Mr. Christian Grosser, Director, Medica Compamed, Director, Health and Medical Technologies, Messe Düsseldorf. Please give them a huge round of applause, guys. Thank you for joining us on stage. Now, I would like to request Dr. Naveen Nishal to give his welcome address. Thank you.
Thank you. Thank you very much, Simran. Respected dignitaries on the stage, off the stage, fellow speakers, healthcare professionals, doctors, and our audience watching us online through our various social media channels. A very warm welcome on behalf of Voice of Healthcare and Medical Care India. Every year, we conduct this conference with Medical Fair India, alternatively in Delhi and Mumbai. The purpose of this conference, Medical Fair, is not only to discuss ideas, challenges, policies, but a larger purpose is that we should invite all the stakeholders who are not directly associated with medical device industry. Like hospitals are directly associated, pharma, health tech, providers, policymakers. So we want to bring out to witness first-hand experience what's happening in this medical device industry. Otherwise, it is very difficult to take time out to visit this exhibition. And if I talk about the theme of the conference, which is innovation, integration, impact, it is very appropriate. While talking about innovation, I think we are innovating every second, every minute, every hour, and we are changing the world. I think adaptability and adoption of technology is is at its peak during this time. When I look back at my healthcare journey, when I entered in my medical college in 1993, and today I see that technology has penetrated in each and every field of healthcare, right from diagnostic therapeutics, pharma to medical device, remote monitoring. You talk about anything, technology is playing a major role. And if I don't talk about artificial intelligence today, I think technology of is incomplete with artificial intelligence. AI is part of everything we are doing. You talk about a thing, AI is already there. And when I see the kind of adoption, the kind of uh, technology deployment at government level, that is also amazing, especially ABDM, NHA. I believe that we are building a very strong foundation, and the kind of impact this technology is creating through these government initiatives is humongous. We cannot even calculate. We cannot even imagine how much impact it will create in a longer run. When I talk about integration, I think earlier companies used to compete. Now companies are collaborating. Collaboration is a big buzzword these days. And if I talk about impact, if you are in healthcare, it means you are already creating an impact. Whether you are a doctor, you are paramedical staff, you are running hospital, you are building medical device, pharma, whatever you are doing, you are saving lives, you are touching lives. In the best interest of the time, I would like to conclude my welcome address here. But before I conclude, I want to share that we have some fantastic speakers today and some wonderful discussions. So I'm sure you are going to enjoy these discussions. Thank you very much. Thanks a lot.
Thank you so much, Dr. Nishal, for setting up the tone. Now, I would like to invite His Excellency Boshan Gair, Representative Taipei Economic and Cultural Center in India. Thank you.
Uh, Dr. Nishal, founding chairman of the Voice of Healthcare, and Ambassador Mustafa, Malaysia, other speakers, and the delegates and friends from both Taiwan and India. First of all, I would like to express my gratitude to the VOH for organizing this event. And I'm very happy to know that National Cheng Kung University of Taiwan, Hospital of Taiwan, is a sponsor all the time in this event. Since I'm here, it's my pleasure to present to you Taiwan's vision for a healthier future and collaborative efforts on the international stage. Taiwan's healthcare system has let me see. Right. Now, why Taiwan is committed to the of health Taiwan, better world, striving to enhance public health, advance medical technologies, and foster global cooperation to improve healthcare worldwide. Our healthcare system is renowned for its high quality and accessibility. And by integrating smart healthcare solutions such as artificial intelligence, big data, telemedicine, and digital health records, we continue to enhance medical services and improve patient outcomes. In alignment with our Health Taiwan vision, the Ministry of Health and Welfare of Taiwan has been actively implementing the healthcare new southbound policy, expanding health cooperation with countries across Southeast Asia, South Asia, and the Pacific. This initiative has strengthened health cooperation networks, facilitated the exchange of healthcare professionals, and promoted the adoption of Taiwan's health technologies. Through these collaborations, we aim to support the development of the health system and smart healthcare infrastructures in our partner countries, while also assisting Taiwanese industries to expand into overseas markets. Furthermore, the Ministry of Foreign Affairs of Taiwan has launched the Diplomatic Allies Prosperity Project to share Taiwan's experience to support the economic development of allies and partner countries. One of the flagship initiatives under this project focuses on smart healthcare and health industries, which assist our allies and partner countries in enhancing healthcare systems. This effort not only demonstrates our commitment to global health, but also strengthens diplomatic ties and contributes to shared prosperity. On an India-Taiwan perspective, my mission has proposed to the government of India on concluding a MOU on health cooperation so as to expand bilateral cooperation in the fields of global health security, digital health, high-tech medical products, and management of hospitals. Through this upcoming MOU, we trust that medical professional personnel exchanges, public-private partnership cooperation projects, and business opportunities between our two countries will be further enhanced. The National Cheng Kung University Hospital is one of the top 5 hospitals in Taiwan, and under the government's guidance of healthcare new southbound policy, NCKU Hospital not only plays a key role in demonstrating Taiwan's healthcare system and medical technologies, but also serves to enhance networking between Taiwan and Indian medical institutions and related businesses. NKU Hospital signed the MOU with Yashuda Super Specialty Hospital in 2023. Both hospitals have been since conducting a number of cooperation projects. We expect to see more cooperation such in the years ahead through NCKU Hospital as a platform. So looking ahead, Taiwan will continue to leverage its expertise in smart healthcare and collaborating with international partners to health the world. Thank you very much. Thank you.
Thank you, sir. Now, I would like to invite His Excellency Dato Mustafa Shah Mustafa, the High Commissioner of Malaysia, for special address. Welcome, sir.
Distinguished dignitaries on the dais, invited guests, industry leaders, participants, ladies and gentlemen. Very good morning. Namaste. Selamat pagi. It is a great honor to be here today at the inauguration of the 9th International Healthcare Conference, held in conjunction with Medical Fair India. This event is a crucial platform for collaboration, innovation, and growth in the global healthcare industry. I extend my sincere appreciation to the organizers for their dedication to advancing healthcare solutions that are more accessible, affordable, and impactful. Malaysia recognizes the healthcare as a fundamental pillar of national development and global well-being. As we continue to navigate the challenges posed by an evolving healthcare landscape, our focus remains on strengthening healthcare infrastructure, investing in medical technology, and fostering international partnerships. Our commitment to universal healthcare access is evident through initiatives such as our national health policy, which aims to ensure that every Malaysian has access to quality but affordable medical services. We also acknowledge the critical role of medical technology and innovation in transforming healthcare delivery. Malaysia has made significant strides in developing its medical device industry, pharmaceutical sector, and digital health ecosystem. We believe that collaboration with global partners, including India, will further accelerate progress in these areas. Events like Medical Fair India provides a crucial platform for healthcare professionals, manufacturers, and policymakers to exchange ideas, explore joint ventures, and create meaningful partnerships that benefit our nations. India has long been a valued partner to Malaysia in the healthcare sector, particularly in medical tourism, pharmaceutical advancements, and research collaboration. The strong ties between our two nations continue to open new avenues for cooperation, ensuring that we collectively work towards a healthier future for our people. As we embark on discussions over the next few days, let us seize this opportunity to forge new alliances, share best practices, and collectively strive for a future where healthcare is not a privilege but a right for all. Once again, I congratulate the organizers and wish all participants a productive and successful conference. With that, I thank you.
Thank you, sir. Now, I would like to invite Major General Professor Dr. Atul Kotwal, Executive Director, National Health System Resources Center, for his special address.
Dignitaries of the dais, all the participants in person and online. A very good morning to you all. First, congratulate the organizers of the 9th International Healthcare Conference for the event and thanks and place my gratitude on record, Dr. Naveen Nishal and the entire team for giving us honor and inviting me here. And also, for to making me aware about this fair which is being held today. I was unaware about this. I just was aware about the conference part as such and saw the entire agenda. But great. In fact, the moment I came here, I immediately rang up my advisor, healthcare technology, that he and his team must visit this fair today. And because we are a think tank of the Ministry of Health, and I've got technical divisions. One of the divisions, healthcare technology, Dr. Sharma is here from GMPZ. He used to be part of us many years ago before I joined. So the entire technology in the health sector, including the HTA and also about the costing and VBQR and all, are made by Healthcare Technology Division of NHSRC in collaboration with other divisions of NHSRC. And Dr. Madan Gopal is here from Public Health Administration, whom I think you all probably know better than me. The conference agenda, whether in exploring, I noticed that sessions center around things like strengthening the healthcare system through public-private partnerships, medical technology, building resilient healthcare systems, human resource for health, leveraging AI and emerging technologies in healthcare, and also shaping the future of nursing to enhance healthcare delivery, and of course the technology and the AI, which the previous speaker also talked about, and the innovation part. I'll start with public-private partnership because with this fair as such, a lot of private organizations are here. I was in Planning Commission 2006 and 7, and there's a time the NHM had just started in 2005. That time, and as well NRHM, and we were finalizing the guidelines for public-private partnership. And NHM has been a major source to get the PPP formed in this country as such from 2005 onwards. And that we discussed the word regulation. I still remember long chats with the then DCH and the advisor and the member health at that time. Anyway, I won't go into details of that. We can have a further discussion subsequently on that. So when I joined NHSRC 4 years ago as the director of NHSRC, the first thing which I asked my team to do, the healthcare finance team to do, was assess the PPP model to this country. So what we realized was there's a large amount of success in the secondary and tertiary care as such. Strategic purchasing, outsourcing, insourcing, you all know the terminology and all, I won't go into details of that. But in primary care, the success has been abysmally low, and especially sustenance. Similarly, for a lot of secondary also, sustenance was the issue. A lot of things started, what was very well, but then a lot of perverse incentives or other kind of incentives or other dynamics and all came in. So in a nutshell, what we found was basically the challenge basically in the PPP were developing, which is along with the process for accountability and governance. The other challenge we found was the contingency planning, gaming prevention of the provisions of the MOU, monitoring and redressal, selection of the private partners, the availability of the private partners as per in a competitive mode, and informal asymmetry due to lack of engagement, information asymmetry due to lack of engagement with the community as such. So to address these, we have already advised the government, and it's available on our website also. And a lot of organizations have already informed us that they have gone through it, and a lot of states we are working with, they also are looking at those. That there's a need for sensitizing the private providers as well as the government officers of the MOUs and all, so that there's a sustainability and there's a contingency planning for each and every aspect of that. Incentive driven, which is the main of private sector as such. So that incentives and timely payments need to be factored in the MOU, and that those delays, to prevent those delays, need to be inbuilt in every MOU as such. And financial support as such from either side, that needs to be discussed, and that's why the primary sector. That's where the financing comes in. That how the private player. So to give examples now under the National Health Mission, diagnostics is one where we are working with states that low cost, high volume can be looked at the primary healthcare system, Center and PHC, the Ayushman Arogya Mandir and CHC and DH. But the high cost, low volume, but which is a major bulk as such, financially, if you see, PPP modes are there, and states are going into this hybrid, like CTs and MRI. Establish it there, or if it is there, then get the in-source models which we are looking at. Same for drugs, the supply. That's where again PPP mode can look at last mile. And there are numerous examples. But consistent engagement of the community of primary as well as secondary care. Even PA, the community involvement very beginning and continue. The other was the health workforce as such, one of the panels as such which we'll be having to look at the technology to how to training of HR. We keep talking of capacity building ad nauseum. In fact, we ask any human resource for health working at the primary, secondary, tertiary level. They say we are fed up of capacity building word. Everyone says that we want to train you. Okay, so we need to look at beyond physical and virtual. Now, AR, VR, and all those kind of augmented and virtual, because there's a new era which is coming in, and also training in AI for the HR as such, because that's where the is going in. Coming to the technology and innovations, just quickly, I'll just a few bullet points. We all know the importance. We all know we are going towards that. But when we talk of that, ethics, the safety, and privacy and security concerns need to be looked at. We see lot of the organizations come to us, we discuss them, but when it come to validity, that's where the longer delays are there, and then comes the healthcare technology. But any technology, when we have to look at before implementing in the public healthcare system, it has to be valid. Validity, not only sensitivity, specificity, is also positive and negative, and also the health technology assessment. So without that, we are not implementing. Sitting here would be thinking that a lot of AI-driven solutions we have in our mind. AI-driven solutions for CA cervix screening, CA breast screening, oral cancer screening. To public health system as yet because of the validity concerns, safety concerns, security concerns, ethics, also the health technology assessment. So that's where we talk about beginning. You have to look at these concerns instead of just innovating for the sake of innovating. So that's organizations represented here. Then innovation built in whatever consortium you built in. So that's any innovator part of that where they get good mentors. We have good innovations which are sustainable over it. Stop here. Otherwise, being from public health, one can keep talking on various issues as such. But looking forward to interesting discussions also later on. And finally, as we embark on today's journey and also this medical fair, which will be on, the shared commitment of innovation, collaboration, resilience, and Dr.
addressing the key issues. We should give proper time to listen to our stakeholders, listen to their grassroots problems. Unless we reach to their grassroots, we will not be able to address their lifetime problems, the issues which they are really facing. This different now this all this would lead to like we would improve in healthcare, and this should also ensure equitable access to high quality medical solutions for. Now as we navigate this transformation era in healthcare, let us work together to environment that fosters innovation while safeguarding the public interest. That is also while extending cooperation, we should not compromise with our prescribed standard. Is one thing, but maintaining standards is another thing. One thing is to keep in mind: if we assure better, we are bound to get better inputs. My one of my gurus told that our output, our input be of such level that even we do not test our output, that level of excellence we have to achieve. That is what I urge with all. I look forward to the insightful discussions ahead and collaborative efforts that and gathering. Thank you so much.
Thank you so much, sir. Now, I would like to invite Mr. Rajiv Nath, Managing Director, Medical Devices Limited, and Forum Coordinator for the special address. Welcome.
Namaskar, everyone. Very welcome. I represent IMED. IMED is the Association of the Indian Medical Device Industry. We have more than 400 members covering various verticals, or disposables, electronics or equipments, and implants, and IVD reagents. I made a simple 3 objectives. One is make in India. Second is manner, and partnerships. It's definitely a day partnerships when we have 15 countries being part of the show and 4 countries on the dais over here today. You're welcome. During COVID time, we saw how teamwork and collaboration across nations and across companies, whether competing nations, was very important for everybody. And I think that's a spirit we need to keep working on going forward. But there's always room for cooperation and collaboration. And then upon this is an event to provide a forum for that. Over the next 3 days, we hope people will take advantage of that. The exhibition has been growing year on year. I hope next we also have another hall added, and the making MyMed will be increased to hopefully 750 square meters from the current 500 square meters. The EPC, which has recently been established, devices, helping to take the brand new flag forward. It provides NU to have exhibitions in other countries and trade delegations as we go forward. The last few days, you must have been reading about newspapers about a lot of turmoil internationally, about of trade situation globally. In every problem, there's an opportunity. I think this is first to take an advantage from. As countries seek diversification, we have opportunities to step in over there and to address. So let us work for that in collaboration and teamwork, and look forward to working with you all.
Thank you, sir. I'd like to invite Mr. Grocer, Director, Medical Compound Director, Health and Medical Technology, for his special address. Welcome, sir.
Yeah, dear ladies and gentlemen, dear esteemed co-speakers, good morning and namaste. It's really my great honor and pleasure to welcome you all to the 9th International Healthcare Conference of the Voice of Healthcare. And it's a Fair India here in Delhi. The Voice of Healthcare Conference has consistently served a platform for high-impact dialogue, thoughtful leadership, and policy exchange. This year, once again, it takes place in parallel with Medical Fair India. Now it's its first team. This parallel structure is not a coincidence, but a conscious convergence. While the Voice of Healthcare Conference is a high-level platform for thought leadership, dialogue, and cross-sector collaboration, the Medical Fair India exhibition offers a practical and technological counterpart, showcasing over 400 exhibitions from more than 50 countries, innovations in medtech, hospital infrastructure, diagnostic, and digital health. Together, these two events form a powerful ecosystem. one where vision meets implementation, where dialogue is backed by demonstration, and where strategic partnerships are born from boardroom insights and shop floor innovations. This dual enables us not only to discuss the future of healthcare, but to touch it, see it, and shape it in real time. A clear example of this synergy is the Future for Health platform, cutting-edge solutions in digital health, AI, and mobile technologies, bringing to life many of the themes we explore here on stage. Similarly, the hospital build zone mission floor offers hands-on insights into scalable healthcare infrastructure, accurate about access, capacity, organization. Healthcare is one of the fastest growing today from a lot of people, set to reach 50 billion US this year. It is in platforms like these, with policy, industry, innovation, partnerships under one roof, that we find the greatest leverage for meaningful, scalable impact. So I encourage each of us to embrace equity, make the connections, and help shape the next chapter of healthcare transformation, not just in, but far beyond. Thank you for your attention, and I wish you all a rewarding, inspiring conference and trade show.
Thank you to our esteemed speakers for their valuable insights and their contribution to continuity of healthcare, setting the strong foundation for today's discussion. And now it's time to heartfelt gratitude to our esteemed dignitaries for gracing this conference with their insights and vision. Dr. to please felicitate. His Excellency Boshan Gair. Request everyone to give a round of applause. His Excellency Dr. Shah Mustafa.
Now, how can we do things better? How can we integrate the public-private sectors together so that we deliver and we cover all the deficiencies that we are talking about? Now, let's try and understand for a moment as to what are these deficiencies. Our biggest problem is our population. It is humongous, it's huge. There's no other country in the world which has to deal with a population such as ours. It's so diverse, spread all over the country with different sort of attitudes and problems and the way we deal with problems. So therefore, we have differences across the spectrum, across the span of the country. Differences in accessibility, differences in affordability, and differences in equity. So this is what we need to address. And to address this, we have a solution. That is the public-private partnership. I heard one of the speakers mentioning about the lack of trust. Well, it is there, but it has to be removed. There has to be trust if we have to go ahead. So let us also think in terms of how do we build this trust. It is high time that we talked about removing this trust and actually walk the talk. We've been talking for too long. We must cut it out and we must walk the talk. Let discussions like this be the beacon light to ensure that we are on the right track. Now, when we talk about public-private partnership, the typical success story or should have been success story that comes to my mind is PMJY and also Ayushman Bharat. Now, has it, and look at this, look at the fantastic initiative. Millions of the population coming out of below the poverty line and slightly above the poverty line, getting full benefits, full coverage to the tune of 5 lakhs per family. Fantastic. But has it delivered the result or the desired result? I think we can all have our own judgment on that. I feel that this very provide healthcare with below acceptable rates of tariff. The government has gone about taking CGHS rates as a yardstick. And CGHS rates have not been revised since 2014. So everywhere else, the inflation is going high. We are talking about inflation. We are talking about controlling inflation. And in the healthcare sector, the government does not seem to understand that there is an inflation. And why should the burden be on the private sector? Let there be a realistic tariff approval. And thereafter, let us talk about public-private partnership. And I really do not understand, with all these budgetary allocations, which takes care of everything, why should there be pendency in clearing of bills? How can hospitals be expected to deliver in Ayushman Bharat when there's huge dependency of bills? Why is it so? Why can't government address just two of these factors? Public-private partnership will work. It has to work. And that is the only remedy that we can think of in a huge country like ours with the magnitude of problems that we have. We have to make our healthcare accessible, affordable, and equitable. Now, when we talk about, I heard a mention about primary and secondary healthcare not being up to the mark in the country. Well, why is it so? Now, let us understand and accept that government cannot take care of the entire requirements of healthcare. Impossible. The government cannot muster such funds. Then what is the way out? Let me put across a thought process. Why can't the government restrict itself to primary and secondary care, which is the requirement of the day? A man in the remotest corner of India is only looking at primary and secondary care. And if he's given that, he's satisfied. As it is, he's satisfied, he's not cribbing. He only talks about his satisfaction level at the time of elections. But if primary and secondary healthcare is taken care of by the government in every possible nook and corner of the country, and with a population pre-designated and also the area of coverage pre-designated, I think primary and secondary healthcare can be provided without much of a problem. Now, coming to tertiary and quaternary care, why should the government get unduly bothered about this? Why can't programs like Ayushman Bharat take care of it? So that the two factors which I mentioned be addressed, and then, if possible, and if there is a need, subsidize where required. There are no free lunches anywhere, and the government cannot expect free lunches. So therefore, let the private sector grow, private sector be allowed to grow, and as far as possible and as early as possible, let these two sectors integrate. We can do wonders. We have got the capacity, we have got the ability, and we have the potential. It is just about putting it to work. And let me hope that today we will have some very useful discussions, and out of which some of the points which we need to address come out loud and clear. And I hope the governmental authorities who are here would also take note of this and further elaborate on it and see what best can be done. Looking forward to a very healthy, very interesting discussion on public-private partnership. I cut short now. Thank you. Let's listen to the panelists as to what they have to say. Thank you.
I request Colonel Manali to start the moderation of the session, please.
Let us start talking about the policy and governance that is required to further enhance the public-private partnership as we see today. I'll pose my first question in this to Dr. Madan Gopal. Uh, the question that I wish to throw across to you is, what are the initiatives which are currently being taken to encourage more private sector participation in public health programs?
Thank you. Hello. Thank you. Thank you for the question. One of the important things which you have highlighted, I won't be going into the uh, dwelling deeper because many of the aspects have been touched upon during the first session. That's first thing. Second thing, you have talked about what the government is doing about the public-private partnership. One of the important things we have been very fussy about this whole public-private partnership. Now, time has come that we should now have a more nomenclature for this PPP. We should be started calling out partnership for what? Partnership for public provisioning. That means provisioning of services. We have to have a better word for this public-private partnership. We start calling it as a partnership for public provisioning. That means how we can provide services to the people by encouraging into partnership. The government is already having this commitment in the form of National Health Policy 2017, where it mentions that how the public sector and private sector they can partner and partner for a common public good. That's one thing. Second thing, if you recall the budget speech of 2017, wherein the budget, the health sector was given an industry status so as to bring in more investments into the health sector field. That kind of thing is there. When the PMJ was launched, it was a kind of provisioning of services to the people about the secondary and tertiary care need. As we know that the private sector brings in the equipments and the high tech, into the services. So we are trying to tap that thing into this. If you look at the example in PMJ program, the 50 crore population at that time was covered. And at the same time, when the MOSPI data was there, it showed that the consumption of inpatient hospitalization was 3%. At that time, there was a thought process whether we do have the adequate infrastructure for having that thing. While the government sector was having around 9 lakh beds at that time, and the private sector 6 lakh. But if this 3% translates into actual hospitalization over the year, do we have the initial investment or not? At that time, I was working in my previous assignment with Niti Aayog when we had a lot of interaction with the tier 2, tier 3 cities, and we saw that we should be investing into we should be encouraging private investment into the healthcare sector so that they can bring up hospitals in tier 2 and tier 6 cities. Now you have seen that many of the states have gone into for a single board clearance because for establishing a hospital, you require at least 40-45 licenses and 40-45 clearances. Now, many of the states they have now gone into a mode where a single window clearance is there, but still it is work in progress because the guidelines and other things were issued like 3-4 years back, but now the things are working in that direction. That's another thing. Besides that, too, because we can't be everywhere, we have to cater to 1.4 billion population. We have to understand that. So, with a consolidated pool of fund with all the other sectors competing with each other. So the pool of the money is limited for any of the welfare activities, including health. So we have to always see that how we leverage the potential which is available in the private sector to the optimum. And PMJ is one of the examples. PMJ, that is Pradhan Mantri Jan Arogya Yojana. I was handling this program as a CEO in one of the states, wherein we at that time in 2008 when the precursor of this RSVY, at that time when working in a state, the state was spending on an average 400 rupees per capita for their services. But there were around 600 hospitals in that state. We say that if you have an insurance component, if you give an insurance of around 600 rupees, we can tap the potential available in this. And that has triggered the discussion you have seen the PMJ. Though operational aspects would be there, but this model has more or less getting stabilized. The challenges would be there because operational issues are bound to be there if you are rolling out a program like this and you are handling 29,000 hospitals. That operational challenge, leave aside the operational challenges, but this partnership has shown that how we can leverage and tap the potential which is existing in the private sector. There are the other examples in the preventive program, the infrastructure mission which we are having. We are trying to tap the diagnostic resources which are available because creating a resource would be time taking. Though we are investing a lot into creating resources in the government sector, but we have to see that as a stopgap or as a other mechanism, how we can leverage the potential of the private sector into our city. That other initiatives are also going on. So in NHM, we are trying to have partnership with the providers so as to have a public provisioning of the service. I usually label it as a public provisioning so that we create a narrative instead of calling it a public-private partnership. We call it as a partnership for public provisioning because the objective is public provisioning. So, because the moment you say public-private, you say that the trust element and other things will come. To overcome that, at least we start calling it as that kind of thing. The coinage and narrative which we can set, I think that will remove the deficit of trust which the current scenario we are having. So we are having the private, the government is having a lot of initiative, be it infrastructure building, be it provisioning of the diagnostic care, be it provisioning of the medical education. So where also, if you look at the various schemes of Ministry of Health, various schemes of other ministries, including the DIPPT and your Department of Economic Affairs, where they always have given some incentive to the private sector. In fact, if you look at the way when we were doing the investments in that study, when we talked to all the banks, infrastructure status to the health was given in 2017. But if you look at the disbursement of all these things, there are very few disbursement when it comes to this. Nobody is interested in taking loans as a health infrastructure because the status was given to some other industries and we have seen how the uptake has happened. But these provisionings and other things, they are always having challenges. It depends on how you manage this partnership. It has to be win-win for both the parties. It's not that it should not be skewed towards one party. if we start talking about that, we are partnering for provisioning services to the public, I think whole of the mindset and everything will start moving. And things are quite visible. If you look at the dialysis program, if you look at the way how the particular section of a hospital is managed in the public sector, how the public sector undertakings they have taken and outsource it to the private sector so that it becomes a win-win for both the situation. There are many examples but we can have endless, but more or less the environment is very conducive for bringing in more people. There would be challenges in rolling out of the scheme, but as you have posed a question that key initiatives are there, policy intent is there, enabling environment is there. If you talk about the vaccine, you see how the vaccine capacity was ramped up through the private sector during the COVID times. There was a COVID Suraksha program was there. Then if you look at the medtech zones and other things, that also an incentive to the private sector, how they are trying to build in the capacities in the private so that the provisioning of services, the use of the services in the public sector is there. I stop here.
Thank you, Dr. Madan Gopal. My next question is to Dr. K. Chawla. The question is, how do you think the regulatory bodies help and can help in ensuring the success of PPP, especially in medtech, pharmaceuticals, and allied health sectors?
Hello. It is okay now. Thank you, Kanan Manali and other co-panelists. Myself being regulator from Delhi Drugs Control Department, and our stakeholders are consumers, industries, medtech professionals, hospitals also, blood banking services, where retailers, wholesalers, startups, and innovators. So almost all part of the gathering which are present here, I have been interacting with them. But as far as partnership is concerned, say, being looking after part of enforcement activities, there is a limited scope of partnership because we have to ensure the quality of medicines, medical devices. This has to be ensured that a proper quality medical device or pharmaceutical reaches to the consumer. So for that, we are taking steps now. As a regulator, the role is changed. Now, regulator has to take over the role of facilitator now to facilitate industry, to share the suggestions, and we have taken certain initiatives from our department. Like we have become more interactive to solve this complexity of stakeholders issues. As I discussed in my opening remarks also, there should be element of accessibility. So we have made sure that all our officers are accessible to public for a certain in the certain timeline, and they can listen to them patiently. They can go to the grassroots level and then try to resolve their problems. So level of interaction has been increased. Second thing which we have decided is like we are going to have, and we are already started, we are having regular meetings with the association. We have our own help desk in our office to extend cooperation, but we are promoting associations also to have their own help desk to help the stakeholders for applying for new applications for educative purpose. We are also conducting seminars and awareness programs for awareness of stakeholders. These have been very interactive sessions, and stakeholders are benefited to a greater extent. Then for better interaction, we have created a WhatsApp group also with the associations. With all major associations of Delhi, we have major WhatsApp group. Whatever advisories, notifications we have from our government side, we try to disseminate the information to those WhatsApp group, and the corresponding associations forward it to their stakeholders. So I could see its success that within few hours, the whatever the message from either side is disseminated to the entire state. We have felt a greater degree of success in this case. Then we have started online platforms also for providing services. Now the applicant does not need to personally visit to the office. They can access these services online. They can log in, they can upload their applications, and their applications are disposed of, queries are raised, and after removal of queries, these are disposed of in within a like time frame manner. It is not that if person is not following up personally, we have a limited timeline, 45 days, 35 days, 7 days schedule for different services. So we are trying to adhere to those deadlines. So these are the steps which we have taken, like to act as more like facilitator rather than regulator, but at the same time without compromising with the quality of drugs and pharmaceuticals. Thank you.
Thank you, Dr. Chawla. My next question is to Dr. Upasana Arora. And the question is, in your opinion, what should be the policy priorities for healthcare reforms in India and over the next 10 years at the least?
Thank you so much, Dr. Rajiv. And I really appreciate, because you and me are working in healthcare from many years, like 35 years. Yashoda is working as a private healthcare institute. But there was no one who was having any kind of budget there. If we talk about previous government, and when we are now finding it that government is also focusing on healthcare in form of Ayushman Bharat, and I feel proud to go abroad and tell that we have a biggest healthcare policy in India, because before that there was nothing we can, when we are in USA and they are saying we have this policy and everybody is covered, that time we were feeling, what to say. And again, if we talk about nursing colleges and medical colleges, so now every district has a medical college, and there is a nursing college, which in this budget our finance minister announced. So, and the most important thing, which we are also part of that, TB Mukta Bharat, healthcare is improving. As a private player, we are supposed to, as we are part of Ayushman Bharat also, in Uttar Pradesh, first kidney transplants done by Yashoda Hospital, as well as we are part of ABDM, we are part of this TB Mukt Bharat, we have adopted. So things are improving, and I am seeing that the way government is working, and especially digitization, is playing a major role. We can be a very good partner with government. Like we are taking Ghaziabad District Hospital for their ICU care as a PPP model, and not they have asked us, and we are not going to ask them that you have to pay us something or something like that. We just want to provide a kind of facility that we are having a digital ICU, and if we can help somewhere. So government is trying to, introduce new things to healthcare, and as a private players, all those who are sitting here, we are supposed to handhold. Reason behind this policy can be implemented by everyone. Not only government hospitals are responsible for Ayushman Bharat, because that is already working. Government hospitals are already giving you free of cost treatment. But our population is thickly populated India, which is I think number one in the world. So we need to, work together. So in my opinion, if like I am going to start my new hospital, which is a 1200 bedded and very very high end hospital in North India, after 10 years digital hospital is going to be reality. Everybody in COVID time was going through, this telemedicine and talking to doctor. Now everybody can see their reports. So digital hospital is going to be very very in. Same time, I believe public private partnership has to be there. So private hospitals, who is the biggest hospital in a district, can handhold CSC, PSC, so they can also get those kind of facilities which private hospitals are providing. healthcare in India is going to change, and that I am 100% sure, because in my journey of 25 years of working, I have seen the changes in healthcare. Lots of people are coming into healthcare, but same time, this is a very alarming situation that foreign fund in form of this private equity is in India. And sometimes I believe when America is putting all the money in Indian healthcare, what will happen after 10 years? So this is an alarming sign which we should think right now. Why they are putting so much money in form of private money like Blackstone, KKR, and Morgan Stanley. Everybody is interested in India. So this shows that Indian healthcare has potential. That is why they are taking interest. But same time, to keep our rates affordable, we need to think about that. So Rajiv ji, it is going to change, but sometime we should wake up and take a call. Should we go with private equity? Because we are into national banks, so I believe in national banks. Thank you so much.
Thank you for bringing in this aspect of private equity. I think we'll cover it a little later. Uh, my next question is to Dr. B. Gautam. How can the private sector collaborate more effectively with the government and government under Ayushman Bharat scheme and other such health schemes to enhance efficiency in the healthcare sector?
Thank you, Colonel Rajiv. So this is a great opportunity. This program has been organized, and I have listened so many important points during the inauguration session also, especially from Major General Atulji and Rajiv Nathji and Assistant Drug Delhi. So the thing is that I'm very much convinced, and I'm advocating that public partnership very much required, especially in the rural areas and beyond the tertiary healthcare centers also, especially in PSC, CSC, and district health center also. The reason behind this, there are so many government schemes right now: Ayushman Bharat, Pradhan Mantri Swasthya Suraksha Yojana, Pradhan Mantri Jan Arogya Yojana, Chief Minister free diagnostics schemes. So it's a great advantage that the rural people, especially in the village areas and semi-urban areas, must get the quality services also. So advocating these things, I want to tell few points. First is that when public-private partnership comes, that quality healthcare infrastructure comes, and once quality healthcare infrastructure comes, that people are getting the services promptly. Promptly means maybe in remote areas there are so many hurdles like transportation, accessibility, availability, and one word told by Major General Atul Kotwalji: accessibility and accessibility. Accessibility means if you are giving the quality services, then definitely people will have belief on government schemes, and they will go beyond that, and they will accept it happily. Second is that technology integration. Technology integration means there are so many digitization is going on, and AI based systems are going on. So leveraging digital health solutions, AI based diagnostic, and cloud based patient records for seamless coordination is very much required. Next point is that capacity building. Once we talk about government infrastructure, or we talk about public private partnership, the first thing comes in mind that whether the people they are working there in the ground or their institution, training of healthcare workers and lab technicians in rural areas through skill development is very much required, because there are so many new techniques, new devices are coming. And I have personally observed, because I am associated with India's largest medical device manufacturing sector. So once device is delivered, but the skilled manpower are not available. That is why the problem is that either machine is lying, or we are waiting for a trained professionals. Next point is that affordability and accessibility, offering cost-effective diagnostic solution and point of care to complement government efforts. Once the price go high, or we compromise on the quality of the medical devices or quality on the workforce, especially healthcare professionals, then definitely we cannot achieve our target. And next thing is that streamlining procurement and supply chain. I have seen that in many places due to L1 case, the quality medical procurement is not being done. So government must take care about that. They must think about that quality based L1 procurement. Not like that they are dumping many substandard rapid test or maybe point of care devices. Point of care devices are very much required and very much essential, but we must think about the quality based procurement. And second thing is that that supply and chain is not disrupted. The supply chain must be available on the time. Like in many state or central government organization, procurement is done at centralized, but the product reach after 3 months or 2 months, maybe beyond that, maybe till that time that rapid test or that point of care device is not required. And last point is that awareness campaign. We must publicize. There are so many government programs, so we must arrange sort of seminars or maybe with the help of ASA workers in villages about the different programs. And the thing is that the scheme must be reached to the right people, because maybe people are unaware of the different programs, and many of the educated persons are only getting the services, and maybe due to illiteracy or people are not very much talented, they are not knowing about uh, schemes, or maybe they are dependent on a third party, and that is why they are involved in some wrongdoings. And next thing is that along with this PPP model, we must leverage on the government, state government schemes also, because there are so many good schemes available by the state government also, so that central government and state government work together with the public partnership, so that rural people and beyond the urban area must get the quality services. Thank you.
Thank you. As we wrap up the first round of this session, which is theme-based, it's very heartening to know that all of us agree on this aspect that public-private partnership is here to stay and it has to do better. I'll just give an example as to what has happened in the defense sector. Those of you know must be aware that the DRDO and the Research and Development Organization has not been able to deliver the goods in the past, and the defense sector generally was languishing. What we see today is a drastic change that has happened in the last 10 years. Today, for a change, India has become an exporter of military hardware. Can you beat it? 10 years' time, we have become a manufacturer in military hardware, and we have started exporting goods. This is the way to go. And if that is possible in defense sector, which is an extremely complicated sector, healthcare is much more simpler. It can easily be done, and I'm sure it will be done in the near future, and the whole country will benefit out of it. We now move on to the next round of the session, where the theme is public-private partnership, a catalyst for change. That is the theme. And I would like to start the round with Dr. Madan Gopal. The question is, how can we bridge the gap between national policy and their effective implementation? Policy versus implementation.
I will just take the example which you have mentioned during our opening remarks. That means the PMJ. Just start with that, because having at the helm of the affairs of this insurance program, the precursor of that, as well as when it was initially rolled out, there was one thing there was zero tolerance for delayed payments. But why these delayed payments are happening? We have to do an introspection, because if you look at the way things have evolved, there is a transaction software and there are certain requirements and checks. Already automated process is automated. But if one person is not adhering to that, automatically it goes for scrutiny. And if you look at the way things have happened, because we do have, name anything, you are having a regulatory guideline for that. But where is the regulatory capacity? Here comes the way that means we have to build a lot of things into the regulatory capacities capacity to regulate so that things start happening. That's the way how we can partner and see that how the national policies which are at the national level and the state level, it has to be implemented in the right earnest. We should not be seeing it as an opportunity to have something out of that. That's why I'm saying that the public-private partnership all are with good intent, but it's the private which is more benefited because that's a kind of perception which is there. We have to work against that perception and create a narrative that PPPs are not just only profit making. It has to be a public provisioning. You have to see that how the public provisioning element adds to that. It's so that it becomes win-win for both the parties. There are many examples. You look at the emergency medical transport system. That's for the first thing which was launched in NHN for the emergency transport system. You see how it has getting stronger and stronger day by day. 108 ambulances, 104, and whatever numbers are there, which are there in the state, but it is known as NHM Emergency Medical Response Initiative. You see, we are supporting around 30,000 initiatives, all run through the private partners. It's not that things can't happen. The policies which are there, if they are implemented in the right earnest, will happen. Main thing which we have one needs to invest is the investment into the this drawing of the concession agreements. Because if we focus on building capacity on how to execute a concession agreement as well as build capacities of monitoring the KPIs built into that concession agreement, I think it would be a win-win for both the things. And whatever national policies are there, that will be percolating down, and you will be seeing good results to the private sector.
Dr. Madan Gopal, thank you very much. I've just been reminded that we are running short of time. So I'll request the panelists to be a little more brief so that we can conclude in the next 5 minutes or so. My next question is to Dr. K.R. Chawla. The question is, as India advances towards a global healthcare destination, what key developments are essential positioning the country as a prepared nation to take on this role?
Colonel Rajiv, as I told, as a regulator, there cannot be like a direct public and government partnership. It is the level of cooperation which can be extended more so that the end user is benefited more. All the regulations should be aimed in such a manner that the end user, that is the consumer, is the change in regulation is passed on to the ultimate consumer, taking care of interest of the persons involved in the supply chain. That is the basic objective. So keeping that in mind, the first thing is that we have increased the coordination and acceptability, where government has taken few steps. See, it is a known fact that manpower constraint is there in government departments, and if some applicant is coming for any entrepreneurship or licensing work or approvals, so it takes time. So that part has been taken care of by introducing third party audit in the regulation. Now, for low risk projects, the need of inspection has been waived off. Approvals are granted without inspections, and facility or whatever project is there, it is inspected later on, so that the assets which a applicant or a consumer has put in setting up the industries, he must have taken the space on rent, he has arranged paraphernalia, he has engaged manpower, so all this he is incurring. If because of inspection that part is delayed, so it is definitely a major burden on the applicant part. So that has been reduced by introducing third party audit. There have been approved notified bodies in field of medical devices who would be carrying out audit. Of course, it would be under the control of state regulator and central regulator. Then we are providing time bound services. The third thing which we are doing is one more thing has been introduced in the sector of medical devices, which is MD42. Within 10 days, we are granting this registration on the basis of documentation only. It is only a registration, and it allows the applicant to carry and distribute the medical devices both by way of retail sale as well as by wholesale. That is a major step. So if you are not dealing in regular pharmaceuticals and dealing only in medical devices, you need not to go for licensing itself. Only registration on MD42 would suffice. That is a statutory change which we have made to facilitate the consumer and stakeholders. Then in class A and B medical devices, which the states are, of course, only states are regulating. Third party audit has been introduced. In class A, we are granting approvals even without inspection from notified body. It is post approval that the audit is being carried out, that too within 120 days of the approval. And as far as class B devices are concerned, which are categorized in just slightly higher risk category than class A devices, this pre inspection has been mandated, but still timeline for grant of approval is there in the statute itself. So with these steps, then we have tried to digitize the whole system. More online services are being provided so as to minimize the visits of stakeholders to the office, which is causing unnecessary problem to the stakeholders. So these steps we have taken for the consumers to facilitate them.
Thank you,
Thank
Dr.
you.
Jawla. Uh, Now, the next and the last question is to Mr. L.B. Gautam. What role do you see for decentralized diagnostic infrastructure in strengthening the healthcare delivery in smaller cities?
Yeah, it's a very good question because decentralizing diagnostic infrastructure plays a crucial role in strengthening healthcare system, especially in smaller cities. The first point goes to enhancing accessibility because in rural and especially village area there are so many daily wage laborers or farmers who don't want to spend even 50 to 100 rupees for going to the district hospital or for the big hospitals, or suppose they have taken this treatment today and the next day they have to wait for the diagnostic test results. So it's a better at bringing diagnostic services closer to patient, reducing travel time and cost. And the second thing is that faster diagnostic and treatment, enabling quicker test result through local labs and point of care, leading to timely medical interventions. That means once the patient gets timely treatment and service, the treatment goes faster and accessibility and affordability comes also closer. Reducing burden on urban centers. We see that there are a lot of pressures in tertiary healthcare, EMS, district hospitals, and bigger hospitals. So once we introduce great infrastructure, especially at the smaller cities, so that patient will at that village level also, and the satisfaction level will come that so that patient will get this services at that center only. Empowering local healthcare providers, strengthening district hospitals and clinics and advanced diagnostic tools and trained professionals so that they are able to deliver at the same clinic or PSC CSC level, so they will don't need to go in the you can see that bigger cities once the trained manpowers are available. Boosting public private partnerships. So again the first point was that once we give this privilege to the private hospitals and private partners, so quality healthcare will come, patient will also get satisfied, and the things will move that, and there will be less pressure on the tertiary healthcare and big hospitals. Thank you.
Thank you. Uh, at the cost of annoying our host, I opened the house for just one question. Please go ahead. If you could introduce yourself and then ask the question.
Take that. You can take that.
Yeah, question actually. I have a suggestion for hello. Yeah. So, sir, this is not a question, just a suggestion. Because, like, I am working with Arman Foundation, myself, Parna Chakravarti. I'm working in the capacity of state program manager and implementing Kilkari and Mobile Academy program in partnership with MOHFW. So, as you have mentioned, sir, only PMJAY, I would like to highlight there is a need for private partnership in the PMSMA program, because we are dealing with
Varsha, I think we'll have to cut short. I'm extremely sorry. We are running against time. You can ask this question, or we'll have to leave it at this point in time. Thank you. Sorry to cut you short like this, but we are running against time. In conclusion, the need for public-private partnership is very well established. The policies are already in place. Implementation has to match pace, and I'm sure this will happen. And just to touch upon the point which Dr. Upasana Arora had mentioned regarding the private equity's entry into healthcare sector, this is a concern. I would strongly recommend that the government takes note of this, because private equity, wherever they enter, their only motive is profit. And healthcare sector is not one where motive can be profit alone. So therefore, I don't think it augurs well, this massive entry of private equity into healthcare. The government, I would request governmental authorities who are here would take note and see what best can be done about this. With this, I thank the distinguished panel for the very valuable contribution. Thank you all, and we wind up this session. Sorry for taking this extra time, Simran. Thank you.
That's fine, sir. Thank you so much. And I thank all the panelists for making this an insightful discussion and shedding light on the impact of policy-driven collaboration and shaping healthcare systems. Now, I would request Colonel Rajiv Manali to felicitate our panelist, Dr. K. Madan Gopal. So let's be on center of the stage. Let's have a round of applause for them and for the amazing discussion we had. Shri K.R. Chawla. Dr. Upasana Arora. Let's have a round of applause for our speakers. Mr. L.B. Gautam. Now, I would like to invite Mr. Rajiv Nath on stage to please felicitate Colonel Rajiv Manali for excellently moderating this session. Now, let's capture this moment with a group photograph. Thank you so much. Thank you so much for being part of this amazing discussion. Thank you, ma'am. Thank you, sir. Thank you. And now we have a presentation knowledge partner presentation by Ms. Vandana Iyer, Research Director, Frost and Sullivan, offering valuable insights into healthcare advancement. I would like to invite her on the stage for the presentation. Let's welcome her.
Hi everyone, thank you for inviting me to this presentation. We are more than honored to be the knowledge partner at this conference. And I know we've run over in our previous session, so what I'll do is try and keep it as short as possible. Here to sort of talk about new opportunities that are transforming India's medical ecosystem. Some of the topics that I will be covering will be the Indian healthcare sector, the healthcare value chain, the medical devices sector, and the way forward for this sector in India. We'll also cover certain aspects of healthcare IT in India, talk about the reforms needed in the insurance and education sector, and wrap it up with outlook towards the end. Madan sir here mentioned about the, yes, I can't hear you, ma'am.
I request everyone to please settle down as we have an amazing presentation over here. So we want all of your attention. Thank you.
Right. I hope we're all settled down now. I've been asked by the organizers to go ahead with it. I remember Madan sir during the previous panel session mentioned the aspect of union budget for healthcare. Now, we've seen a very positive development as far as the budgetary allocations are concerned. There's been a 2% increase since the previous year, which is reflective of the growing focus in the Indian healthcare sector. Now, India is definitely known for its IT services globally, but healthcare is the next big sort of growth opportunity within the Indian landscape. And there is great government backing, the healthcare budget being the first sort of indicator of the growing focus in this area. Moreover, we've seen the removal of customs duty across 36 cancer drugs. There's been an announcement to have 200 daycare centers established in rural areas for cancer care. There is the extension of the Jal Jeevan mission and growing focus on medical tourism in India. All these factors will definitely help unlock new growth opportunities within the Indian medical sector. And there's also government focus to increase the healthcare expenditure within states by 8% and allocate that budget to healthcare to see substantial growth. All these sort of developments focus on the rising importance of healthcare in India and will definitely help unlock new growth opportunities. What we definitely heard Atul sir say was the focus on primary and secondary healthcare, so much so that the need for tertiary and quaternary healthcare decreases to a great extent. And the key to achieving that universal healthcare coverage is to ensure primary healthcare is affordable, accessible, and penetrates to the deepest rural within India. Economic Forum. Every country across the world spends about 10% of their GDP on healthcare, but India, being the most populous country in the world, has a GDP expense percentage spend of less than 2%, which is abysmally low. And just to sort of even meet the healthcare needs of a populous country such as India, it is important that we are able to match that 10%, if not be more than 10% of our healthcare sort of expenditure on GDP. So that has to change going forward. And one way to achieve that is public-private partnership. I will not elaborate on that more because we had a very good discussion on that earlier today. But that holds the key to improve healthcare delivery across the nation. Another topic that was touched upon by Gautam sir was decentralization of healthcare delivery. Now, Tamil Nadu has sort of perfected this model to a great extent, wherein the immunization coverage in 2023-2024 was over 95%, which is more than the national average of 93.5%. Now, if this model can be replicated across the states in India, immunization coverage can be much higher than what it is today, and will sort of re-emphasize the focus on primary and preventive healthcare practices and reduce the dependency on tertiary and quaternary care going forward. There are several models that Tamil Nadu uses, which is MTM, mobile health, DEIC, and several others, and some of them can be replicated across states and scaled at the national level to help achieve better healthcare delivery. Going towards the medical devices sector. Now, there is a great dependency on imports. About 70 to 80% of medical devices from countries such as US, China, and Germany are being used in India. However, that narrative has to change for India to truly emerge as a global medical device leader. And to flip that narrative, our exports should be much higher than that of imports, which is not the current scenario now. Rajiv sir had mentioned in the earlier session that, India is emerging as a manufacturer of military goods, and that can be replicated across the device sector as well. And the Make in India initiative by the government of India is one step towards achieving that goal, because there are several special economic zones that have been established to boost medical manufacturing in India. And you see companies such as Siemens Healthineers invest in R&D facilities in Bangalore to develop medical device products and boost India's manufacturing sector to a great level. Additionally, there's been an artificial organ development facility that was set up at Andhra Pradesh in the Andhra MedTech zone. These are all indicators of positive development of localized manufacturing for medical devices in India, and is likely to sort of fuel new development and flip the narrative and reduce the dependency on imports going forward. To sort of truly revolutionize the medtech sector, what is needed is development across robotics, digitization, and improved usage of wearables. Now, there is a company called SS Innovations that has developed SSI Mantras, India's first clinical grade surgical robot. It's CDESCO approved, and it costs 3 times less than the gold standard, which is Da Vinci. Da Vinci costs about 15 crores, whereas SSI Mantra just costs about 5 crores, and it's comparable in terms of capabilities. So this opens a very important opportunity related to affordability and accessibility of Indian medtech innovations, and can help improve equitable healthcare accessibility going forward, not just in India but across the world. Digitization is again a key point that was talked about in the earlier discussion. There are several companies such as Cure AI. They're using deep learning techniques to interpret medical imaging data and derive better insights and reduce the manual errors while interpreting complex medical imaging data. There are many companies that are promoting wearables. There's Medlotech. They've developed a clinical grade wearable called Vinsense. They help in tracking real-time NCD markers, and this can really help in changing your lifestyle and diet intakes and monitor them in real time, especially when India is fast becoming the diabetes capital of the world. It's super important to have medical wearables which are directly available to consumer and reduce the propensity of obesity and diabetes in the nation. And well, of course, then we wouldn't need drugs like Mounjaro or Zepbound to come to India and sort of manage obesity at that rate. Moving on to the next sort of aspect is the growing importance of healthcare IT in India. I think it came to the forefront during the COVID-19 pandemic, wherein there was a marked reduction in in-person physical consultations and a great increase in online consultations. And this sort of led to understanding of the potential of Indian IT sector in capitalizing on that opportunity, because telehealth was able to bridge tele healthcare service provision gaps, particularly in the context of growing internet connectivity. There are over 0.75 billion active internet users as of Jan 2024, and some of the lowest data costs provided worldwide are in India. So, India's e-Sanjeevani initiative that was launched in 2019 was supported by over 150,000 Ayushman Bharat health and wellness centers. We've been able to provide over 250 million consultations as of 2024, and this is a promising area of growth opportunity and will help reducing systemic inequalities in healthcare access and access. And there are several Delhi-based startups such as Beto and Dozy. There's also Wealthy Therapeutics, which was recently acquired by TrueDoc Healthcare. They're facilitating faster video consultation and enabling real-time remote patient monitoring for better disease management overall. And there's also the Ayushman Bharat Digital Mission Initiative that was launched in 2021. That is also a step towards improving healthcare IT delivery in India. The last point that I'd like to talk about is the need for reforms within the insurance and the education sector. Insurance spend. Do you want me to go back? Do you want me to remove the chairs because you can't see them? I was talking about the insurance penetration. It remains low despite the increase in demand for health insurance, and a lot of consumables such as diagnostics devices are not often covered in medical insurance policies. Having that included in insurance policies will improve access to healthcare, especially in rural and BPL families. Medical curriculum also needs to be reformed in India. It needs to be focused more towards practical approaches and de-emphasize sort of rote learning practices that's prevalent across the country today. India presents a very good opportunity to encourage the education of healthcare professionals. However, the sort of accessibility of medical practice of Indian healthcare professionals in countries abroad is fairly limited. So if there could be more collaborations, not just from the PPP angle for the industry, but also from the education standpoint, it'll help sort of standardize medical education across the world, so that in true sort of Indian medical professional can be like a global healthcare practitioner going forward. To sort of conclude the section, the key sort of factors that will shape the outlook of the medical device sector in India is interoperability, accessibility, PPP, as well as digitization. Bangalore that's developing nanorobots for root canal treatments. Rajiv sir has programs that can help address dental health issues, also established in Chennai in 2021. Recently, they've set up like a world-class manufacturing facility in a special economic zone, and will be able to sort of create world-class disinfection robots, both for hospital as well as home care settings. Now, these robots will not only disinfect surgical sort of theaters and hospital settings, but will also help disinfect the surgical robots such as Da Vinci. If anyone has seen how a Da Vinci robot looks, you'll know that it's like manually impossible to disinfect it, and you will need robotic and automation techniques to sort of achieve that level of disinfection and prevent hospital acquired infections. uh, in 2025, what India did was they announced the release of 10,000 of whole genome samples, which is archived at IBDC right now. And this can really help develop India's progress towards precision medicine development. There are companies such as MedGenome that leverage AI for interpreting genomic data, can use this database to develop medicines for a vastly diverse Indian diaspora as opposed to relying on Caucasian genomic data. The World Economic Forum, Apollo Hospitals, and leading healthcare organizations, they launched the Digital Healthcare Transformation Initiative in 2024. And this is likely to sort of leverage India's PPP infrastructure to help close healthcare gaps and create repeatable as well as scalable digital healthcare models in the future. Now, I belong to a division within Frost and Sullivan that's known as Tech Vision. And what we do is we look at mega trends that shape technology innovations across 9 different clusters, including healthcare and the medical devices cluster, and try and understand how they transform markets globally. What we do really well is identify top 50 technologies every single year. We're in the 15th year of that exercise, wherein we look at over 3,000 technology entities and assess them using a combination of qualitative as well as quantitative parameters to arrive at top 50 technologies that are likely to be disruptive in the next 3 to 4 years, and also look at future 18 technologies that will be productized in, say, 7 to 8 years from now. What we've done this year is looked at top 50 technologies across the 9 different clusters that you can see within the healthcare sector. We were identified intelligent imaging analysis, stealth surgery, GLP-1s, as well as corporeal therapeutics as some of the important and disruptive tech areas. We also do our Future 18 exercise regularly every year, and also do personalized convergence workshops, wherein we help people create billion-dollar ideas for new technology development by combining one or more technologies together and try and identify what are the new technologies that are likely to be disruptive. One instance of this is we've spoken to innovators such as Professor Novoselov and sort of profiled graphene in our research much before it became a Nobel-winning discovery. We're very excited to present that to you. We have, of course, a global client base that we work with. And should you have any questions regarding our top 50 research, don't hesitate to reach out to us. With that, I'd be more than happy to close the session today. Thank you.
Thank you so much, ma'am, for this amazing presentation. Your expertise has provided us with a deeper understanding of emerging healthcare trends, equipping us with valuable knowledge as we move forward with today's discussion. But at this moment, we are honored to launch a highly anticipated white paper titled Unlocking Opportunities Transforming India's Medical Ecosystem, authored by Ms. Vandana Iyer, Research Director, and Neeraj Jadhav, Senior Industry Analyst and Team Led, Tech Vision Analytics, Frost and Sullivan. This exclusive Frost and Sullivan Insight is prepared for Medical Fair India, an initiative by Medicare Asia and organized by Messe Düsseldorf India. The white paper delves into key strategies and innovations shaping India's medical landscape, highlighting advancements in medtech healthcare policies and ecosystem transformation to foster growth, efficiency, and collaboration. Now, to officially unveil this white paper, may I invite on the stage Ms. Vandana Iyer, Research Director, Frost & Sullivan. Ma'am, can we please have you on center? Mr. Gernot Ringling, Managing Director, Messe Düsseldorf Asia. Mr. Ajay Gulati, General Manager, Messe Düsseldorf India Private Limited. Mr. Christian Grosser, Director, Medica Compomed, Portfolio Health and Medical Technologies. Mr. Adarsh Verma, Project Director, Medical Fair India, Messe Düsseldorf India. And Mr. Bhavesh Prasad. A huge round of applause as we witness this milestone launch that will contribute to shaping a stronger and more progressive medical ecosystem in India. Thank you, our esteemed dignitaries, for joining us on this special moment. Thank you so much. Thank you, ma'am. And now I would like to invite Ms. Khushbu Chahar to please felicitate Ms. Vandana Iyer. Ma'am, request to stay back. Vandana, ma'am. Request Ms. Khushbu Sharma to felicitate Ms. Vandana Iyer for this amazing presentation. Thank you so much. And before we move into our next panel discussion, let's take a moment to reflect on important aspect of healthcare innovation, medtech. Technology is rapidly transforming healthcare, we all know. But do we truly understand the scale of its impact? With AI, robotics, genomics, and digital health solution integrating into mainstream healthcare, it is crucial to assess how these advancements are shaping patient outcomes, accessibility, and industry growth. One key factor in this transformation is India's dependence on imported medical device. So, for this, I have one engaging question for you all. What percentage of medical devices used in India are currently imported? Guys, I need your attention. The question is, what percentage of medical devices used in India are currently imported? A, 25%, B, 50%, C, 70%, and D, 85%. Any guesses? This is a very simple question. I believe I can get more hands on this. Okay. Someone from the back who raised, I would request to please introduce yourself first and then answer. Can we have mic there?
Myself, Sharad Kundu. I am from KR Mangalam University. The answer is C, 70%.
That is correct. The answer is C, 70%. Can I have a round of applause for him? Thank you so much. Yes, a significant portion of India's medtech industry relies on imports, emphasizing the urgent need for domestic manufacturing. innovation, and global collaboration to build a self sustaining, cutting edge healthcare ecosystem. And this brings us to our next session, MedTech 2030 from vision to reality. India is emerging as a key player in global medtech supply chain with cutting edge innovation, strategic partnerships, and advanced technology transfer, paving the way for more efficient, sustainable, and value driven healthcare ecosystem. This session will explore India's role in global medtech ecosystem, the impact of global collaboration, and building value-based procurement models for healthcare sustainability. And we are honored to have an exceptional panel of industry leaders who will share their insights and expertise on future of medtech. Now, I would like to invite our esteemed panelist on the stage, Mr. Rajiv Nath, Managing Director, Hindustan Syringes and Medical Devices Limited. Let's welcome our panelists with a round of applause. Mr. Himanshu Baid, Managing Director, Poly Medicure. Mr. Aditya Kohli, CFO and Director, Allied Medical Limited. Let's welcome our panelists with a round of applause. More louder, I believe. Thank you. Mr. Bevesh Chakravarti, Head Regulatory and Government Affairs, South Asia Biomeri India. And now I would like to invite a moderator for the session, Ms. Anu Motri, founder of CEO Kriya Group of Companies. Let's welcome her with a round of applause. Thank you, ma'am. Over to you now.
Thank you, Simran. It is my honor to welcome the panelists and great to see my industry colleagues here. Welcome. So, these are indeed exciting times for medical device manufacturing in India, especially with a staggering number of 70% imports. I see this as a huge opportunity for us. Especially with the recent geopolitical shift and all the change in the trade relations. We are well, as a nation, we're well on our way to establish ourselves to becoming a major manufacturing hub for medical devices. So with that said, I would like to start off and set the stage for this panel. Especially given that we're on a time crunch, I'd like to keep it really nice and short and focus more on the questions and the answers, especially since we have a very experienced and a stalwart group here. We have two rounds. The first round will focus on India's role in the global medtech supply chain, the challenges and opportunities, and the round two will focus on collaboration, value-based procurement, and the future outlook. So without much further ado, the first question goes to Rajiv Nath, Managing Director, Hindustan Syringes and Medical Devices. So Rajiv, what key policy interventions do you think are required for India to strengthen its position as a global medtech manufacturing hub?
Hi. Thanks for the opportunity and for the question. To be a strong global player, India already has drafted a National Medical Device Policy 2023, where the vision is to make India as the #1 manufacturing hub. From IMED, we were aiming to be top 5, but the PM wanted it to be #1. And in their strategy paper, they've defined 6 strategies. The first one is to streamline regulations. What we see from the industry side, our perspective of streamlining regulations will only come when we have a separate law book and separate regulator, which is manned by engineers and scientists and not by pharmacists, who understands international regulations, and we are having the best of regulations available in the country aligned to the best in the world. Then we can have mutual recognition agreements and trade agreements internationally and RRAs between our regulator and international regulators, like even countries like currently Brazil, Malaysia, and Singapore are doing, and we are being left behind. The second area is in terms of accelerating investments. And for that, the government has come out with the medical device park policy, PLI policy, which was not really successful. And last year, they came out with a marginal investment policy and policy for skill development and a policy for supporting clinical investigation expenses in India, which will allow people to show their product to be clinically evaluated and safe globally. These are the supports available from the government, and hopefully the disbursements, when they come forward, will accelerate and attract investments. The third area is in the area of public procurement. In public procurement, the government policy has been to give advantage to Make in India products. And this is something which is being done similarly internationally. This motivates manufacturers who are committed to their market share in the country to put factories in that country over there to sustain their market share. And hopefully with that, with more manufacturing coming into India by the established global players, they'll start using it as a base, not only for the Indian market, but also for the global market. That's where the vision for becoming the manufacturing hubs would be faster realized. The next area is in the area of innovation. Here again, the government has come out with the PRIP scheme, which is under review and seeking expression of interest. And the government feels that this will also be helping to accelerate. The government's own Department of Biotechnology and DSG and BIRAC, from DBT, have got already various schemes and BioNS who are bringing in an excellent system for innovation and commercialization of medical technologies and supporting entrepreneurs and startups. The next area is in terms of Brand India. And for this, the government has established the Medical Device Export Promotion Council, which has started functioning day before yesterday and started taking in membership. And this will be helping to bring in a focus on medical devices internationally rather than taking part in pharma exhibitions under a Pharmexcel banner, which creates confusion. There'll be a focus on branding Indian medical device industry globally in exhibitions like Medica, Arab Health, Medical Fair Thailand, and also over here in India. In all these steps for the government, IMED is fully supportive of the government's policies and working with the government in partnership. And we hope that with fast implementation and monitoring of the policies, our vision will be realized. The government already has been kind enough to split the Department of Pharmaceuticals into two sections. Now there's a separate section which is looking purely after medical devices, a separate team which is looking after policy, pricing, sales promotion, and exports. So with the separate team now fully allocated from Joint Secretary downwards to medical device industry, which has a mandate to promote medical device manufacturing and exports, we expect better coordination with the other ministries and other departments. Thank you.
Thank you, Rajiv, for the 6 policy interventions from the strategy. Really appreciate that. The next question is to Himanshu. How do you envisage India's medtech industry enhancing its manufacturing capabilities to meet global standards and increase exports, and especially in high-end products? Because I think we're rapidly evolving in the consumable space. However, I think there's more work to be done on the high-end products.
See, I think India has a great potential now, looking at the current geopolitical situations, to increase its export basket. And of course, in consumables category today, India is doing very well, and we have more exports than imports, and I think that's going to further change as the years come by. I think on the high-end equipments, the biggest challenge which we see is the availability of critical parts and raw materials. Still, I think 70 to 80% of the industry depends on China or nearby countries for critical parts and components. And if that ecosystem is not developing, it will be very hard to match competition coming out of China and to manufacture products in India and go for the global markets. So in my view, this ecosystem, which is now beginning to, we are seeing that little bit getting developed. System around manufacturing. So critical raw materials are also not available in India. So today as a company, we have 300 vendors outside India who are importing critical raw materials. So that also makes the manufacturing more expensive in the country because we have to import, pay duties, look at the supply chain, invest more in working capital cycles to bring this kind of raw material. So I think raw material base also needs to be enhanced in the country. And of course, it's a chicken and egg story, but I think somewhere, some initiatives need to be taken. And some of the schemes Government of India has launched last year, I think, which Rajiv already highlighted, I think that is going to play a very important role where, a lot of backward integration should happen there. I think another point which is very important today, there's a big struggle for companies which are into equipment space, high-end equipments for getting into export markets. And there are many regulatory barriers for that. Today, even to get a basic CE certification for this kind of equipments would take years together, and that also becomes a barrier. And because we don't have MRAs and we don't have mutual regulatory let's say acceptance or approvals between the countries. So even if you are regulated in India, you have approvals in India, it doesn't mean anything. And when we are looking at India, India is not a market. Let's say India, I say India is a market of 4 billion people, not 1.5 billion. And because today we have the whole global south, which is a market available to us, and we look at the first entry point. And in that entry point, if we have regulatory barriers, then it will be very hard for Indian companies to export. So I think a lot of changes, need to happen in that area also to help exports to grow. But and also when you look at the advantages, let's say today we lose a lot on the freight today. India freight costs are still very, very high compared to China when we are exporting to global markets. So if we can, bring out that cost lower for Indian companies, I think probably that will also help a lot in taking Indian products to global markets. Because some of the products we lose out, to China, and sometimes our freights are almost double of China today. And so that was also one of the key reasons where we lose out. So there are many challenges, but and also when we look at export incentives also, today we have nothing, almost nothing available. And when we look at countries like Singapore or Malaysia or let's say Thailand, they offer or even China, they offer a lot of incentives to local industry to scale up faster, which is probably not available in India. And even if they are available, let's say the PLIs and all, they didn't work well for the industry. So I think we need to create champions of the sector, each sector, industry, and these champions needs to be handled by the government. And that's what we have seen happening in other neighboring countries. And probably same model has to be replicated in the country.
Thank you, Himanshu. Those were excellent points that you made. It brings to my mind, in my previous life, I was from the automotive industry. And I moved into medical device manufacturing. So when you were talking about the supplier ecosystem, Tamil Nadu and certain areas of India did extremely well growing themselves over the past 4 to 5 decades in automotive manufacturing, establishing the supply chain ecosystem. And as everybody knows, a car is a fairly complex, bit of equipment, and actually medical devices are fairly complex and equally, if not more complex. And It requires a lot of integration in terms of engineering integration, technology, firmware, hardware, software, and that supplier ecosystem is super critical for us to actually excel and as a high-end manufacturing hub, to create the high-end manufacturing hub. So I can completely resonate with your point on that, and I hope that somehow as industry leaders here, we're going to find some way of propagating that and figuring out how to make that ecosystem come together. So excellent points on regulation and regulatory aspect and freight as well. And maybe we should all have an offline conversation about that. The next question is to Aditya from Allied Medical. How do you see India's competitive edge evolving in the areas of critical care, anesthesia, and emergency medical technologies? And in the brief offline chat that I had with you, you could technology transfer playing a role in this, and how you think that could lead to that competitive edge.
Hi, good afternoon, everyone, and thank you for putting that to me. I represent Allied Medical. We've been into this space for the last 40 years, and particularly into manufacturing life-saving medical devices for the last 25 years. We've seen over the last few years happening in this space when we talk about life-saving medical equipment, whether it is critical care, anesthesia, or emergency medical equipment. The PLI scheme, I agree with Rajiv and Imanshu when they say that the scheme didn't really take off so well, but it still worked to get a lot of new companies into that space. They weren't able to enjoy the incentives out of that, but still, it a lot of people, a lot of investment went in there, and a lot of new players have come up since, or the existing ones have scaled up. So I think that was one of the drivers. And then the medical device parks, the government has come up with 6 different medical device parks, and some of them have been focusing on this space, whether it's anesthesia or critical care. The story of ventilators during COVID, and since then how things have expanded in that space. I think there's a medical device park in Yeda, which particularly is trying to promote more and more manufacturers to come in, on the PLI products. So I think this was one of the category in the PLI, anesthesia and respiratory critical care. Other than that, the regulation was one of the main reasons which was not happening for last many years. CDSCO has very recently come out and fully implemented all the regulations, and now everything is controlled. You cannot just sell a life-saving medical device without having a license for it. Every medical device being imported or manufactured in the country has to have a CDSCO license. Without that, it is strictly an illegal activity that you are indulging in, selling an unlicensed medical device. So I think that was a big ask from the industry for many years, and that has recently been fulfilled. So I'm sure over the years, as the implementation improves, that will bring about a lot of quality changes. And with the vigilance program, also the MVPI, I'm sure the users also get a lot more power, to report any devices which are not working well, which will push all the manufacturers to ensure that the quality is well above the minimum benchmark that they set. The PPO orders of the government, Make in India promotion, that is something again which has fueled a lot of domestic activity in this space and as well as other spaces. I think now it's time to increase the minimum threshold, which was initially very minimal. You could be even with 20% domestic addition, you are qualified as a domestic manufacturer, which I think it's time for the government to rethink that and maybe work up the percentages, what the minimum contribution domestic has to be before you call it a made in India device. That will also restrict a lot of misrepresentations which are currently happening and with the PPO space. Likewise, the Ayushman Bharat has helped so many hospitals to expand in the tier 2 and tier 3 cities, particularly, and a lot of new setups coming up, which has opened up the market for all of us, whether we are in this space or any other medical device space. I think you were talking about the technology part. To fuel that, a lot of schemes have come, but so far, we have not really taken off. A new scheme is now there in the picture, PRIP, and we are hopeful that with that there will be R&D activity into this space, and that will help to push the R&D activity further. Of course, medical devices require a very long gestation period, and it takes a long time before you're able to get it right. And particularly life-saving medical devices, class 2 or class 3B, you have to be very, very sure that you have the device working fine before you go to market. I think regulation is one of the biggest challenge when you talk about going global. You know, uh, irrespective of the amount of money it requires to get a CE mark or an FDA mark, the bigger challenge is it is taking in India to get a CE mark for a class 2 or a class 3 product. There is not enough testing infrastructure in place. The testing labs take ages to respond. Even if you go to a regulatory body to get a quote, they take typically 6 months to give you a quotation before you start the process, and then it takes anyways from 2 to 3 years before you can get a mark or an FDA certification for any of your class 2 or class 3 devices. Compared to other countries, they are able to get it in 6 months, and 3 years is a long, long time. And this after you develop the device, everything is good to go, and everything, but you still have to wait for that before you really go global. Uh, I think the export promotion incentives, like Manchu pointed out, that India hardly incentivizes exports, particularly in the medical field, compared to our neighbors. We have very recently, like Rajiv mentioned, a couple of days back, the MDEPC has come into play, which we had been asking for the last 10 years, and finally, Export Promotion Council dedicated for medical devices. We are all hopeful that this is going to take things forward in a big way going forward, and all of us will be able to go global faster and scalable. So yeah, I think that's it from my side.
Thank you, Aditya. Very well said. The next question is for Bhivesh, Head of Regulatory and Government Affairs, South Asia, BIMARU. With evolving regulatory frameworks in India, this seems to be the topic for this panel today. We're all really, trying to figure out how to crack the Da Vinci Code of regulatory framework for medical devices here, not just in the domestic market, but most importantly, overseas as well. How do you see the role of government policy shaping the future of medtech innovation and adoption by 2030?
Good afternoon, everyone, and thanks VOH for giving this opportunity and also choosing this topic. I think this is a topic which has been discussed in every forum, whether the medtech industry would achieve 30 billion by 2028 and 50 billion by 2030. So whether it's a reality or whether it's a dream. So I would like to say that whether we'll achieve 30 billion by 2028 or 50 billion by 2030, let's not go into that. But what is important that is that medical devices industry going lot of changes. The market is very dynamic. The policies from the government of India, from Department of Pharmaceuticals are also quite encouraging. And for sure that there are various policies which have been pushed by the government and also being nurtured by various departments, which is making the industry more and more challenging. So when you say that the regulatory body CDSCO is doing their role as a regulator in terms of the harmonizing the regulation with the other regulatory bodies worldwide. Then there are some push by other ministries like BIS is also pushing for the standardization, which is also one of the steps for Make in India, but it's also making the standard more horizontal than making it vertical, so adoption of the international standards. And at the same time, there are various incentives as discussed by my colleagues, that PLI, then medtech parks, and also at the same time, because of the Indian medical devices is getting more and more attractive because of the increasing disease pattern, then spending on the middle class at rising income level. Then there are various preventive healthcare checks and also pushed by the government of India on increasing the infrastructure on the uh, various at the medical college level to the district hospital. So there is a increasing spending by the government of India. So which makes the market more attractive. So you can see in last 9 months there is a increasing private equity investment. There is increasing foreign direct investment into these sectors. And for sure, the medical devices industry in India is one of the most attractive market because the growth is um, uh, strong double digit, and it is going to grow further. So, so because of various things and making the vision to reality, I think we need to have the more collaborative efforts between the industry, academia, startups, incubators, hubs, and more close approach between the government and with various bodies. And I think there are challenges and there are opportunities at the same time.
Thank you. Thank you, Bhavesh. This brings us to a close on round one. Some excellent answers. Moving now towards round two, which is we're going to talk about collaboration, value-based procurement, and the future outlook. So this question is to Rajiv. I'm going to change it up a little bit, Rajiv, the nature of the question based on the answers that you spoke about. Um, this it's about how can India improve its medtech exports and reduce dependency on imports. But what I'd like you to comment on is specifically how do you see the Export Council, the Growth Council playing a role, and how do you envisage this really supporting the improvement in medtech exports and reducing our dependency on imports? And how do you, some concrete your expectations on this?
Well, the Export Promotion Council has been set up with various objectives. Uh, First and foremost is in terms of strategizing, we've got 7 different verticals in medical devices. Each vertical needs to be having a different nuanced strategy to succeed in its markets globally. Whether it's disposables or consumables, whether it is electronics and equipments, whether it is instruments or implants, and whether it is classifications. Low risk, medium risk, moderately high risk, and high risk. The value add, of course, is in the high risk devices, but the volumes are low. The volumes are high and margins are low in the low risk devices. Historically, India has done better in this kind of products. 2 years back, for the first time in the various verticals, our exports of disposables and consumables overtook our imports of consumables and disposables. Now, one can try to address weaknesses or one can try to build on strengths. Our recommendation to the government has been to build on the strengths. What you're good at, keep on doing that. And what Himanshu mentioned just recently, the government needs to focus on a few domestic champions, because once those domestic champions succeed in entering a market and establishing the brand India credibility in that market, the other competitors follow on that success story. Historically, the export promotion councils in various domains have been getting grants like the MAI from DOC, and they've been holding exhibitions or taking, I would say, delegations of exporters to certain countries uh, and holding exhibitions with very small booths over there. So if you have an exhibition with the 6 square meter booth or a 9 square meter booth, does it really give a brand image as the first experience or not is the key question. When you go to a restaurant, when you go to a hotel, when you buy something in a department store, you go to a grocery store, you've got an array of brands in front of you. The first experience is the most important experience, and if you find that good, you'll come back again to that brand. That's why it's important to have the good experience first with credible manufacturers with a good brand story and a good experience, and others can follow that. We have seen, unfortunately, and my own personal experience, many markets get destroyed because people try to export at very low marginal pricing and very low cost with very poor quality and very poor packaging. It's just a price game alone, trying to compete with China only with pricing. And then those markets start expecting the same price from us. You're from India at the same cost. If he can give it, why can't you give it? Now, if that is a price me too game, and if other want to follow it, some will follow it, some will not. And the ones who follow it are echoing that same poor quality, poor shabby packaging, poor brand image, and a fragmented image. So you go to those countries over there and those bazaars over there, whether it is Uganda or Tanzania or Kenya, example, just as an example. No brand would be sticking for too long over there. The next low price one will replace the earlier one. And that's not building brand India. With an EPC, we are hoping that we'll be having a more strategy which will be going to be for the long term. Like in businesses, certain companies succeed, some don't. Some brands succeed, some don't. The onus will be on the EPC to understand the nuances. Having understood that medical devices are different than pharmaceuticals, it's more like a consumer product, like Hindustan Lever markets its products, or an equipment manufacturer like Godrej markets its products. That is the kind of marketing support which is also required in medical equipment in India and globally. We can play the OEM game or we can have our own brand building game. Both markets are available. But whether you go OEM or whether you go brand India, bottom line is quality. If the quality will not be behind the brand will only stay so long on that market shelf. So that's where we expect that EPC to bring that focus over there. Thank you.
Excellent. It's very heartening to hear this. I think in terms of quality first, and it's so essential to build brand India. And this is what I believe is going to help us crack the Da Vinci Code as well, the regulatory framework. Now that takes me to the next question with Himanshu, who has successfully, I think, congratulations. I know Polymedicure had announced that for almost 70 products, you got CE certification. So congratulations on that, and you have successfully cracked that regulatory code. Now, given that medtech is a long tail, long tail game, it's a long game, and especially with all these barriers to regulatory, what kind of strategies do you think can be adopted to enhance accessibility and affordability of high-end medical devices without compromising on quality and innovation? I mean, it's not easy getting all those regulatory.
See, I think Rajiv's already stressed on it that there is no, let's say, shortcut to quality.
Exactly.
And Indian companies, if we need to keep that brand flag high, and whether any brand, when we talk about, we need to be at par with quality and performance.
Absolutely.
With the global players.
Yeah.
So it's not about quality certifications you carry, it's also about the performance of the product. And then is the price factor. Of course, India has the advantage of able to produce products at a lower price because of the ecosystem we are in today. When you look at manpower costs, competitive costs between India and China, or maybe other nearby geographies. So I think the two important things which I think are very important for Indian companies to look at is the performance of the product. Quality will come in anyways, that's for sure.
That's a given.
Yeah, certificate is a given.
Yeah.
So the performance of the product and then continuous innovation. So if you don't continuously innovate in technologies or products which you are today, let's say, making, you'll not be able to succeed in the market because there'll be somebody in the market who will be able to produce lower than you. So unless until you continuously look at that innovation curve, in any category you are entering today, You have to see that what innovation can I bring in this category over next 3 years, 5 years, 10-year period, and will I be able to sustain my product line over that innovation? And probably that is the key today. And if Indian companies can't think in that direction, probably will not get too much of a, let's say, importance in the global export markets. So we have to showcase India as an innovation hub and also talk about products which talk about performance, consistency in quality and performance. And quality means quality of manufacturing. So we have to move more towards automation, more towards technology, more bringing in AI in manufacturing. So these are some of the things which are very important to have a consistent quality product with almost zero defect. When our PM, honorable PM says zero defect, zero effect, and I think that's very important that Indian companies have to realize that we have to start making products. You can't have products with inconsistencies. Some are good, some are bad. And I think, Bobby, that pulls down what Raji was trying to say. So we need that consistency in performance and quality.
Thank you. With more, just to build on that, with obviously using AI and using technology means a lot more investment, right? So do you think that will, how do you think the balance between leveraging the lower labor rates with investment in technology, how do you think that would play into the whole affordability aspect?
See, I think you have to see yourself as a global manufacturer and not as an Indian manufacturer.
Exactly.
So if you need to access global markets, and I think then both go hand in hand.
Yes.
And it can't be just one of the other. So I personally feel that when you are going to markets like Europe, US, and maybe other, the global South, everybody is looking at your, what you can make and how you can make the product. And today, most of the customers would come and visit your facilities, and they are not coming and visiting facilities first time. So they want to see something which is already there globally. They want to, rate you amongst other large global players, and then only they will buy products from you.
Yeah.
It's not about that, you blindly sell products out there and people buy blindly. So I think that's having a great big include infrastructure is very important. Following GMP standards requirements is very important. And so that image building is very important, that Indian companies can also invest in technology, in good infrastructure, and probably that also acts as a marketing tool for us to go to global markets and tell people that we also in India have great infrastructure, great equipment, great machinery to make products for you.
Thank you. I can resonate with that, given that we've been working really hard since we're MDSAP certified for 5 countries, for US, Canada, Brazil, Japan, and Australia. And that makes a huge difference when we have our customers visit, and I can certainly resonate with your thought process there. Thank you. The next question is for Aditya. How do you think India can develop a sustainable ecosystem for medtech startups and MSMEs to compete on a global scale?
Thanks, Anu, for putting that to me. Again, I represent a company which is an MSME organization where we are in the medium space. And the problem with the whole system is that as soon as you move above from micro and small to medium, everything gets taken away. So we are labeled as MSME, but most of the privileges or incentives of being in an MSME get taken away as soon as you become a medium-sized company. I think that is something the government needs to address. Secondly, we are talking about medtech and taking it global for MSMEs. I think as Indians, all of us grow up with a very price-sensitive buying behavior culture that we have witnessed over the years. And I think being in medtech, one of the biggest disservice you can do to your technology business is if you are using price as a winnability when you're trying to sell your products. Just the initial ownership is not so important. Relying on price as a differentiator, you are not really going to get the market that you're trying to capture on. And I strongly feel that if you are in medtech, that's doing a disservice to your own company. You have to look at overall ownership of the product. When we look at any medtech device, internationally, the lifespan is 7 years. In India, it is 10 years. That's what the typical expectation is, or the guidelines also are there, so to speak. So you have to look at it ownership over a period of 7 years or 10 years when you're looking at the product, not just what the initial cost of that product is going to cost you. I think to further facilitate MSMEs, the medical sector needs something like what has been created for the defense sector, IDEX, which is an innovation of defense excellence, which is trying to promote more and more defense products being manufactured in the country. Very recently, we've been able to win a contract with them where we are developing some patient transport units for the Indian Air Force. So the cost of that is being subsidized by the government, and we are paying a share of that. But I think medical devices, if the government is serious about taking this forward, I think we need something like that for the medical sector to come up, which can handle more and more MSMEs to get more and more funding into R&D. Likewise, the MDEPC, I think we've all been talking about that since morning, and Praveen, who's heading the MDEPC, was here in the morning. I wish he was here for our session. He would have taken back a lot of feedback, but I think he's not here. He had to leave for a meeting. So I think that's going to play a crucial role in taking MSMEs global. They need a lot of support. They need a lot of hand-holding, particularly after COVID. Every country is moving up their barriers. It is more and more challenging to export medical devices into newer markets. The regulations are going up. Just like India has moved up their regulations, every other country is moving up their regulations. So the MSMEs to go global will need a lot of support in getting that documentation right, getting the understanding of what the documentation is for every country, because every country has their own set of standards that they want you to comply to. I think access to capital and finance is again a big challenge when you talk about MSMEs going global. There also some intervention is required because when you talk about med tech devices, the gestation period is very high. It takes anywhere from 3 to 7 years before you come out with a device, and then by the time you get the certifications, you're looking at a very long period. So it's not possible for MSMEs to sustain that. And of course, you get a little bit of domestic share in the market once the device is out. And with BIS being playing more and more proactive role, particularly in our sector, we found that whether we talk about anesthesia workstations or ventilators or defibrillators, BIS has recently come up with new standards, which are pretty much the same as what a CE standard or an FDA standard looks like. Rather, they might have some additional requirements as compared to what CE or FDA is asking today when we look at the new standards which have come out. I'm not talking about the old BIS standards, but as they are coming out with newer ones, they are fairly credible, and we've been fortunate enough to receive the first India license for anesthesia workstations and defibrillators for the devices, and I'm sure many other companies are also going forward with getting those certifications. But the problem is that is not going to help us globally. That's only the Indian market. I think maybe we need to look at initiatives how we get global recognition for the Indian standards. Till the time we can align the European standards or the American standards to become the process to become faster.
Thank you. Thank you. Thank you very much. So the final question is for Bhavesh, and I've been flagged by the organizers to wrap it up fast, so I'm really sorry about this. So if we can keep it short. How can collaboration between regulatory bodies and industry leaders, great segue to what others mentioned, and healthcare stakeholders accelerate innovation and ensure seamless adoption of medtech solutions across global markets?
Long question.
Yes, yes. It's about,
I think
yeah.
I completely agree with Rajiv, Himanshu, and Aditya. I think they have covered all good points. What I can say is that innovation is the key word, and there are a lot of innovations going on around in medical device. I share my recent experience in last week. So there was a India Innovation Summit at this same venue, and it was focused on tuberculosis. And I could see that there are more than 25 to 30 companies, Indian companies, who are already at a different stages of development. Some of them are developed real-time PCR kits for early diagnosis of tuberculosis, including the drug susceptibility. Then there are companies who are into whole genome sequencing, and there are companies who are into handheld X-ray machine with the artificial intelligence. So what I can say that the innovations are already happening, and there are various products are being developed, but what is lacking is that the startups or these MSMEs lack the guidance how to go the product further into the regulatory approvals and into industrialization. So I think that is one of the key. When you speak to them, they are not at all aware. So I think there is a need for handholding is there.
Yeah.
Second, my experience had begun open on 24th March on World TB Day, where most of the states has done very well in the government of India's 100 days TB free campaign, and everybody got their appreciation from the health minister. And there is a complete involvement of starting from the parliamentarian, then the block level, the panchayat level, and I think the whole nation state is doing a great job. We have done great job in polio eradication. Then TB, National TB Elimination Program is one of the good. Then NACO on HIV. So at the different level, the policies are getting implemented from the push from the government of India. And same thing would happen in medical devices with the various, now there is a new R&D schemes, and then there will be revised PLI 3.0, and medical devices parks are coming. So I think the uh, the things are changing. It's not that, but at the same time there are things which are getting. So now there is a more stringent process for the exporters for medical devices because somebody is not doing something good. So we are going two step further and one step backwards. So right.
Thank you. Thank you, Bhavesh. Thank you very much. So this about brings this session to a close. So I'd like to thank our esteemed panel members, Rajiv, Himanshu, Aditya, and Bhavesh, for your very not only thoughtful answers, but very thought-provoking ideas and answers that you've put out there. And again, thank you for your time and thank you for your amazing participation.
Thank you so much, Ms. Anu, for excellently moderating this session, and our esteemed panelists for sharing your insights and expertise with us. And this was an enriching session. So our panelists have shared invaluable perspective on how medtech, innovation, and global partnership are shaping the future of healthcare. And now it's time to express our gratitude to our esteemed panelists and moderator for their valuable contribution. May I request Ms. Anu to please felicitate our panelists. Mr. Rajiv Nath. I request everyone to give them a round of applause. Mr. Himanshu Baid. Mr. Aditya Kohli. Mr. Bhavesh Chakrabarti. And now I would like to invite Ms. Khushbu Sharma to felicitate our moderator, Ms. Anu Motri, for leading this impactful discussion. Can we have you all on center of the stage for a group photograph, please? Thank you, panelists, for such a thought-provoking and visionary discussion. The idea shared today will serve as a roadmap for India's medtech industry, driving innovation and global collaboration forward. And let's keep this momentum going as we move to our next segment of the day, which is lunch. So let's take a short break and network over lunch while engaging in meaningful discussion with fellow attendees. I request everyone that please gather in next 20 minutes for the second half of the conference, as we have much more engaging and impactful sessions lined up. Thank you so much. See you in next 20 minutes. So this morning we explored policy reforms, medtech innovations, and public-private partnerships, critical components in shaping the healthcare landscape. As we move forward, we now shift our focus to the role of healthcare providers, the technological evolution of hospitals, and the future of healthcare delivery in a rapidly changing world. But before we dive into our next session, let's reflect on a groundbreaking healthcare innovation that has transformed the way medical services are delivered remotely. I'm talking about telemedicine. So, here is a quick question for you all. Who developed the concept of telemedicine for healthcare application? Option A, NASA. Option B, World Health Organization. Option C, IBM. And option D, Google. Any guesses? I can't hear you, ma'am. I don't think so. Any more guesses? Yes, the correct answer is NASA. In 1916, NASA pioneered telemedicine to monitor astronauts' health in space, laying the foundation for modern remote healthcare application that now enables telecommunications, AI-driven diagnostics, and digital health solutions. So, was this from Google? Anyways, that's fine. So this brings us to our next session where we will discuss the pivotal role of hospitals and healthcare providers in strengthening healthcare system and ensuring that quality care is accessible to all. And this session is powered by Graphic Era Institute of Medical Sciences, and we are supporting partner for this session to make this session possible. So, hospitals and healthcare providers form the backbone of any healthcare system, playing a pivotal role in delivering quality care and ensuring equitable access for all. As medical advancements, infrastructure improvement, and digital technologies continue to evolve, healthcare providers must adapt new challenges and opportunities. And today we are privileged to have an esteemed panel of experts joining us to share their insights and expertise on building resilient healthcare systems. Now, I would like to invite our panelists on the stage. Dr. Puneet Tyagi, Medical Director and Senior Consultant Pulmonology, Graphic Era Institute of Medical Sciences. Welcome to the session, sir. Let's welcome them with a huge round of applause. I think we had a very amazing lunch, so energy should be high now. Dr. Yun Ching Ko, attending physician, Department of Emergency Medicine, National Cheng Kung University Hospital, Taiwan. Dr. Atithya SP, Executive Director and Medical Director, SP Medifood Hospitals. Dr. Komal Patel, Vice President, Medical and Paramedical, Medical Director, Parul Sevashram Hospital. Let's welcome our panelists with a round of applause. Dr. Manoj Mittal, Chairman, International Chamber of Healthcare and Medical Tourism. Dr. Kunal Behrani, Clinical Director and HOD Neurology, Marengo Asia Hospitals, Faridabad, will be joining us shortly now. Now, I would like to invite our moderator for the session, Dr. Nitiraj Gandhi, Managing Partner, Medium Healthcare Consulting. Thank you so much, sir. Now it's over to you. You can take it ahead from there also.
Good afternoon, everyone. Hope everyone's had some good lunch. So, just before we start, it's okay to, take a quick nap, but it's not okay to yawn. And also, I think it's okay to raise your hands in case you have a question. I'm sure we'll give some time for it. There's a time allotted. And a big thank you, first of all, uh, to Dr. Nischal as well as the entire VOH team for organizing such a good conference and having such an esteemed panel with us. It's a privilege to moderate this session. The topic is very interesting and something that we've been exploring since the morning. What are the different challenges that healthcare systems are facing? India, in its uniqueness, the number of geographies that we deal with, the number of dialects that we deal with, as well as healthcare situations that we deal with, and the sheer burden of population. I think all of that presents a very significant challenge. When we look at the non-communicable diseases and the burden that is just growing, with a very, I wouldn't say weak, but skeletal framework of public health infrastructure to support the same. The larger burden of it lies with the private healthcare institutions. And individuals who are on this panel and within this room have played a significant part in shaping up this healthcare system, somehow managing to carry the burden very successfully. As we move into this next few years, probably the next 25 years, we are faced with multiple challenges. One is an aging population. The other is technology itself. How much and how do you use technology? Because on one hand, you have a population, a young population that needs to be working. On the other hand, you have solutions like agentic AIs and others, which will require some sort of trimming of jobs and automation of functions. And the third and most important thing is out of hospital care is going to be very important. The kind of money that we are seeing being invested in private healthcare, that is largely on in hospital care, not preventive care, but curative care. So how does all of this get addressed? How resilient will our systems be? How will providers respond? That is something that we'll try and explore in a few bits. Obviously, it's an extensive topic, but maybe we'll just delve into a few aspects of that and carry forward the discussion. So just to start the discussion before I take my seat, I'd like to ask Dr. Tyagi, what are the emerging aspects of training that you think need to be incorporated in medical education to deal with all the changes, whether it is AI, whether it's telemedicine? How do we need to change our conventional ways?
Good afternoon, all. I welcome you all on behalf of Graphic Era Institute of Medical Sciences. And the question, hello, this is also gone. Hello. So the question is how to improve the medical education and to make the healthcare more resilient. So what has happened in past, lot has changed. When I was graduating, I was a graduate. I joined medical school in Delhi, Maulana Azad Medical College in 1989. So that time it used to be a complete rote learning, and initial years we were never exposed to the clinical sciences, clinical sites, and we were only limited. We were studying anatomy, physiology, and biochemistry. A lot has changed since then. What has happened now is there is a vertical integration now in the medical education in India, basically, and so it is a horizontal and vertical integration. So the clinicians, they take part and they take the anatomy classes and they teach the physiology along with the preclinical people, faculty. Another thing that has happened over the years is in our time there was no simulation based training. So now it has come up, and every medical college, it is necessary to have, each medical college needs to have a simulation lab, and we also do have, and now all the medical colleges are having the same, and the students are getting trained on that. But apart from it, and it is a competency based training now, so that it has to be more practical, so that because initial teaching period practical aspects were missed. But again, there are some things which are missing, and I think those things should be incorporated in medical education system, especially at the undergraduate level also and at the postgraduate level also. One is interprofessional training. So I still remember when I was I was a senior resident, and what they used to do when they used to take exam, so they will we have to the students, MD students, have to make a diagnosis on basis of just history and clinical examination, and no clinical data was provided to them. So same thing. So the exam was going on, and I was senior resident, and suddenly they asked the student, "What is your diagnosis?" But suddenly one of our examiner, who was from PGI Chandigarh, he gave him the X-ray. He said that this is what is done in real world. You make a diagnosis when you have an X-ray and you have other investigation, then you make a diagnosis. So same thing, I think we need to have interprofessional training now, and that should be incorporated. Because when, for example, when we work in ICU or when we work in emergency, we are working with the nurses, we are working with other paramedics. But whenever we are doing a case presentation and when we are taught, and so all these aspects are missing from there. So it should be a combined training and teaching program. After that, another thing that is missing is empathy. Basically, if we see, there is a huge psychological burden on the patients regarding the disease. And we see this in ICU, the patient who are psychologically good and who have got a strong willpower, they do very well. But apart from the patients who are not psychologically well and who give up. But this aspect is never taught. So I think the psychology should be the part of the curriculum. So how to take off this burden of the patients rather than treating them as machines, and how to treat them as humans and take care of their emotions. I think that will improve the outcome in long run. After that, another thing is nowadays medical legal aspects are also there, but in undergraduate level or even in postgraduate level, nobody is, especially right now in India, nobody is taught regarding these medical legal things. And the key point here is, I think, the communication, because communication is missing. So it is the communication. If proper communication is there, then there are very less chances of medical legal aspects coming up. But nobody is teaching how to communicate. The students, they never, and communication is an art. It cannot come up within a night. So we have to take care of this. And another thing is then quality. Quality is one thing. Now the hospitals are aggregated, and some are JCI accredited also. So, but never in our education, in undergraduation or postgraduation, students are taught about all these standards. So I think that is must. And as we faced COVID in 20 and 21, so now it has become very important to teach students on all levels how to manage disasters, public disasters, basically. So they should be trained in that, so that all these things can make our healthcare system more robust. And apart from this, I think there is Dr. Atul Gawande is there, who I like this many of his books. The book is Manifesto. And it's a great writer, the person who covers. I think the students should read his book. They are not part of the curriculum, but they are very good books, and we get a great learning from all these books. And apart from them, I think all these things, I think AI and all digital technologies that are coming up, all the students should be well versed with them. Thank you.
Thank you, Dr. Tyagi. Dr. Yushin, coming to you. A lot of hospitals as well as countries have benefited from sharing of interdisciplinary knowledge as well as some of the local and regional knowledge. And Taiwan also has now some prominent university hospitals as well as teaching hospitals, which run collaborations across countries like Philippines, Malaysia, and others. So what's your view on collaborations, and how strong can collaborations be some of the key areas of collaboration to facilitate resilient healthcare systems?
All right. Good afternoon, everyone. I'm Dr. Kuo. I'm from Taiwan. That's my privilege to be, here and talking. Thank you for the time, and thank you for having me here to share this. I work in the field of emergency medicine and also in the field of disaster response. So regarding the question, we're talking about collaborations between different countries, cross-border trainings. We're talking about international partnerships. So I would like to address the international partnership first on how international partnership can enhance the knowledge and knowledge exchange and training basically for emergency healthcare professionals. So let's talk about it. Basically, we can enhance these in three ways. One is capacity building. The other way is knowledge and skill transfer, which is rebuttals back to our questions. And the third way is actually on crisis responses. So when we talk about capacity building, we actually do it more on trainings and education. So this brings back to collaboration between different university hospitals and what I was talking about, cross-border trainings. Let me give an example. For example, we have joint training programs. Why do we have joint training programs? It's because we want to make sure that these are all standardized emergency care trainings. Of course, some might be contextualized so that it fits different kind of environments. But basically, the basic needs and the basic principles should all be the same so that these trainings are standardized. We have what we call the trainers models, where we have different medics from different hospitals, different regions, different countries, where we train them so that they could go back to where they were from so that they could train the locals. So that way, this is a more sustainable program. We have what Dr. Taiki also mentioned, simulation-based trainings and learnings, so that when people come, they can modify what they've learned in high-income countries in the low-resource settings. So one of the examples I could give is that I was in Marshall Islands, Marshall Hospital before. We had different collaborations with the students there. We basically trained them in Taiwan, in med school. They go back to their countries as GPs. And afterwards, after staying, practicing medicine, practicing clinically, they will come back if they are interested in specialist trainings. So I do have a specialist training in emergency medicine right now, a resident that is now working with us in Taiwan right now. So these kind will make sure that these programs sustain so that they can, give more back to their community after learning. So this is one thing. And second of all, I was talking about knowledge and skill transfer, which is kind of similar to this because this is a fellowship and exchange programs. We have a lot of fellowship and exchange programs in different specialists and specialties. Let's talk about emergency medicine, where I'm working in the emergency department. We have not only students, but also residents for fellowships and also paramedics that are coming in for more pre-hospital trainings. This is another part of that. On my third point, I'm talking about crisis response, which we call, or disaster preparedness. Why is this so important in international partnership? Is because, let me give an example. As we all know, Japan and Taiwan, we both experienced a lot of earthquakes every month we have big earthquakes. So how does international partnership with Japan kind of helps us in this? Is that I work in the DMAT team. DMAT is shortened Disaster Medical Assistant Team. So we work in collaboration with Japan's DMAT team. We do have simulation drills, exercises to prepare us so that when crisis does happen, when this disaster does happen, we can actually act rapidly. This networking, when there's no disaster, will help us respond even more rapidly when the disaster actually happens. So these are my 3 points on how international partnership helps.
Thank you so much. Picking up from your point on sustainability, Dr. Aditya, if I would I would like to ask you, the country went through a high burden of COVID cases, and as it is, it has a high burden of other diseases also. How does one start building sustainable models when almost 70-80% of the care is delivered in private healthcare?
Good afternoon. Thank you for the opportunity. See, sustainability in a system like India is obviously very challenging, right? Especially when every state you go, the cultural, the social, the political scenario is different. And to create a universal, sustainable healthcare system, which has been working all over, is particularly very challenging. But I feel the 3 A's which can really get to at least a framework where we can talk about the sustainable healthcare department. One is affordability, correct? And the other one is obviously affordability. Next one being, the framework should be acceptable. So these are the 3 A's I would like to jot down when we talk about sustainability. the whole question is we cannot name something like this. So I'll tell you basically a framework in which this can be jotted down. So a framework will particularly have 4 points. The first one being environmental sustainability. So when you talk about environmental sustainability, I have first-hand experience. Recently, our hospital down south. So I come from Kerala, in Trivandrum. So we're the first hospital in Kerala to have the JCI in the 8th edition. So even in JCI, the 8th edition, what they have added new huge chapters is based on environment and what global impact hospitals or healthcare systems is having on the environment. So they talk about how you can have a green hospital, how you can minimalize waste, how you can optimize your usage, things like that. And the assessors are very, very particular, in about this chapter. And they had spent almost one whole day out of 5 days just briefing us about the environmental impact. So that is very, very important. The second, obviously, is the customer who's using it, right? So customer in the sense the patients. So every hospital, every healthcare organization is focusing on how you can bring the best innovation, the best technology at the most affordable rate. And in a place like India, everybody knows how challenging it is when insurance companies are starting to monopolize. It is dictating what kind of rates you need to mention. So that's a huge challenge, and the customer kind of knows pretty much all the treatment options. They come to us with what kind of treatment option they want. So second point is that. The third important point to mention is employer sustainability. So as doctor had mentioned, and especially in a place like Kerala, it's very hard to bring down the attrition rate. The staff nurses, when they find an opportunity, they just wait and they fly out for better opportunities. So more than financially keeping them happy, it's about what you as an organization can offer them. And that is when, cross simulations help, exchange of knowledge helps. There is skill exchange when there is collaborations which is happening. So I think employee sustainability is very, very important. So these are the three main things which I feel will create a healthier framework for a sustainable healthcare system, which will in turn keep a future also in mind. So these 3 points are important for a framework, I feel.
Thank you so much, Dr. Aditya. Now, just continuing from that point where you mentioned that continuing with good employees is very important, and that brings me to Dr. Komal, who has large amount of experience in training. So when we talk about sustainability, one is the infrastructure or processes, but the more important part is how do you make people more resilient? How do you upskill them in a certain manner? And how can that empower organizations?
So, I am basically a gynecologist. So I very well know that when you are practicing, updating yourself by continuously attending different types of workshop, conclaves, and participating in hands-on workshop is definitely required for preparing ourselves for the future health challenges. And as we all know that medical field is ever evolving, so continuous medical education is the one part which is required to update yourself for giving a better patient care and to have a quality care for the patients. Second thing is that now the new technologies like digital imaging, telemedicine, and AI is involving in the healthcare. So getting that knowledge and to learn that things is also very much important in practicing for healthcare workers also, and for doctors, paramedics, everyone. Third thing is, I think that as the new emerging healthcare challenges is coming up, like what we had in COVID pandemic, and the new treatments are inventing day by day. So gaining knowledge of all this is also important to provide a better healthcare delivery to the patients. And likewise, we at our university, what do that we organize every year national healthcare skill conclave. So in this we invite everyone from the healthcare sector, starting from the paramedics to nursing staff to the doctors also. So they work as a team. So last time we created a trauma management drill. So in this trauma management drill, everyone has to work like a team. So when you work in a team, you will be in a better position to handle any of the situation, and you will act promptly and effectively when you work in a team on a particular emergency situation. So this is the one thing which upskill the healthcare personnel to deal with the future challenges. The another thing is, as Tyagi sir has said, to learn about collaboration and to learn about communication skill also. So training has to be there, and at our medical college we have this Prayas, a medical education unit, where we organize different type of workshop on communication skills also, and even for the soft skill also. And we gather the technology people from the biotechnology also, people from the agriculture side also, and doctors and the paramedics, they sit together, they discuss the different problems which they are facing in the practice, and together they try to find out the solution for all these problems. And another thing, that we have to update ourselves for the changing rules, ethics, and the standards in the healthcare. So these are the few points from my side which I find relevant to upscale, rescale, and again skill ourselves for the future health challenges.
Thank you so much, Dr. Komal. Now, just changing the topic of discussion and moving towards medical tourism. Obviously, we have Dr. Manoj Mittal here, who has extensive experience in that. And so we've seen that India is becoming a hub for medical tourists. If you could just give us a bit of an overview about the industry and some of the drivers for medical tourism, that would be great.
Good afternoon. India is now becoming a hub for medical tourism, no doubt. Heal in India, the government initiative, is promoting this sector in a big way. There was a participated big way. There was a big delegation from all over the world who participated in the G20, and we highlighted, the best is basically, when you visit, you see where we are. So the entire world has seen our we have highly skilled doctors, and part is there is no waiting time, or almost a waiting time in India. We attract a lot of tourism. The patients here, there is a almost US and they don't get the leading minimum time. It is so uh, government highlight everybody to visit uh, cost. So this is a 1/10 of the cost as compared to the other procedures we have.
Thank you so much, Dr. Manoj. I'll segue this into a discussion on how do you foster international collaboration? And I think Manoj sir as well as Dr. Aditya spoke about accreditations, JCI, all other things. So Dr. Yushin, if you would want to just speak a bit about how knowledge exchange plays an important part and at what levels. The knowledge exchange can be at multiple levels, whether it's at a government level, tie-ups with insurers. What do insurers require for such medical tourism to be facilitated? The knowledge exchange could be about protocols, guidelines, and all. So if you could just speak about it a bit.
Um, I beg your pardon. You want me to talk about knowledge exchange,
Knowledge.
right? All right. So right now, I work in a government-based hospital. So we do have a lot of government policies and programs for those countries that we have political ties with. A lot of these countries are what we call lower resource countries. So what we do is that we have programs that ensure their space. They will come to learn Chinese first. After learning Chinese, they will be enrolled into our med schools. There are a few certain med schools that we have that have these collaborations with these countries. In these med schools, they will first learn medical knowledge. They will learn, of course, Chinese and how to approach to patients in this kind of environment. So after these kind of programs, they will be going back home and then, putting what they've learned into use, practical use. So these is one kind of program that we have done before. The other kind of programs that we've done before is what I've mentioned before, training the trainers programs. Because we come and go, to be honest. When we go to these countries, we come and go. So how to make these programs more sustainable is to identify local focal points, local trainers, and train them to become trainers. Right. So I think that these kind of programs have more sustainability. So just a few months back, I was in Afghanistan. This is working with an NGO, now with the government. So what we've done is that we did programs for basic life resuscitations for low resource countries. We contextualize the whole program, the models, so that it fits the context there. We identify some focal points, some doctors there, and then we went to train them so that they can be trainers in the future. So these kind of program will be more sustainable in the future. So we do work in different ways, but I do feel like trainings are more sustainable.
Thank you, Dr. Yushin. I'd now like to take this up with Dr. Tyagi. Um, she spoke a lot about training trainers and knowledge exchange. What are some of the best practices in terms of medical education or otherwise? Now we are seeing some of the startups who are looking at ambulances being provided in 20 minutes or so, and that would require an extensive amount of training. So, just your views on the training aspect.
So that is what I mentioned, because now we are training all these students. We have a skill-based training also. So we are conducting this BLS and ACLS programs to train them. And even in ambulance, now we are training paramedics also, and all the nurses in our hospital. They are BLS trained, and most of them are going to be ACLS trained also. So whenever we pick up a patient from any remote area, because Dehradun is situated in Uttarakhand and it is a hilly terrain around Dehradun. So many a times we got call, and so the treatment starts from ambulance itself, and we are trying to put this telemedicine in place. And along with that, we are doing lot of community training also in the surrounding areas. And around our hospital, there are many universities. So we are training students. We are giving them BLS training, and we did this with the IMA also. So by the time help reaches there, and so at least some care provider is there who can take care of these things specifically.
Thank you so much, sir. Dr. Aditya, what are some of the key lessons? Like Dr. Jaggi spoke about Dehradun being such a hilly terrain. We've seen enough of the pandemic already. are some of the key learnings that hospital administrators can take?
Before that, just to add on to what Dr. Tyagi said, see, this is exactly what is community building all about, right? So even say bigger hospitals who can afford a lot of tech and a lot of technology, what we do in collaboration to other smaller hospitals or other government hospitals is we have chosen super trainers in our hospital. That can be doctors, that can be staff nurses, EMTs, technicians, everything. So on a periodic basis, we invite staff members and medical practitioners from other hospitals to us so that they can get trained with the specified set of tech or advanced infrastructure. So that has narrowed the gap. Hence, that helps a lot in community building. So that is one huge step which has actually taken place after the pandemic. And on a personal front, what has happened is, say, in 2019, we were planning to build a, say, 500-bedded hospital. Post the pandemic, we had a lot of changes inculcated to the infrastructure of the building. One such change would be we have around 221 ICU beds, and all ICU beds have physical barriers, and that has helped us a lot in infection control and things like that. So predominant focus on infrastructure because of the pandemic has helped us to combat something like this. Unfortunately, if it happens, we can combat it better. And second is to bridge, or say you have a particular tech or an advance, how to get that into the community is a huge challenge in something in a place like India. So this is how we combat as a hospital and give back to the community as well. Yeah.
Thank you so much, Dr. Aditya. Dr. Komal, just to focus a bit more on the training aspects also. Training also involves an academic point of view. Hospitals day in and day out are doing a lot of firefighting, and on the other hand, in academic institutions, we train them, or academic institutions have a very set pattern where training about what goes on in disasters and all is not really so structured. Similarly, if concepts like artificial intelligence are coming in hospitals, that is not a part of the academic institutions right now. So how can these two cross pollinate and help build a healthier system, if I would say?
So, in our university, we have almost hospitals in the campus. So, we have that privilege to connect the academic people with the professionals who are working in the hospital. So, as I previously said, what we do, we run a think tank series. So, we have copied the Shark Tank series and we run, and we named our series as a think tank series. So, once in every 2 months, we keep this think tank series. In this series, the professional, the healthcare professionals who are practicing, they sit with the technology people. And previously, as I said, the agriculture people also come there. And the people from the Ayush sector, as sir has said, that people are focusing more on holistic development. So we invite Ayush sector people also, their practitioner, the allopathic practitioner, the technology people, the agriculture people also, because they are into more into organic farming and all. So what we do when we admit a patient in our allopathic hospital, apart from giving them allopathic treatment, our Ayush practitioner, they also treat the patients, and the food which we supply, that agriculture people will also monitor what type of food, the raw material is coming into the canteen, and our dietitian look after what food is given to the people. So we have seen a tremendous outcome in the patients of stroke and cancer patients while combining the different academic people together with the practicing professor. So I think combining both of these people give a good result in quality of the patient care. And second thing is we are involving more and more people from the practitioner side in our board of studies. So board of studies usually design the academic curriculum of that particular course. So we invite people from the industry, we invite people from the healthcare sector who are practicing to take their inputs, and they usually give us advice in how we can design our academic course for our medical courses which we are running. So in that way we are training our students for the real time problems. And as we said previously also that we organize a frequent workshop and we have state-of-art simulation center. As Tyagi sir has said that it is now a norm that every medical college should have a skill lab. And so we have made a state-of-art skill simulation center at our university, in which apart from giving training to our medical students and people from other healthcare sectors, paramedics and nurses, we involve the practitioners also in training them in this skill lab. Another thing is when we have to have a shared spaces for this medical practitioner and researchers. So both of them work together on a particular project and they can have a good result in a particular problem area which medical practitioners are facing. Another thing which we are doing at our university, that we run a startup studio. So recently there was a visit of PM of Spain in Vadodara for inaugurating one of the project. So the first lady Harshab, she scrutinized the different startup studios available in the Gujarat, and she selected our startup studio to visit. So what we do every year, we organize Vadodara Healthcare Startup Meet. So in this meet, we invite the different healthcare startups. We also invite the angel fundraisers who fund this new startups, and we also mentor these startups, and we also help them in technology transfer also. So this is the another thing which each university or an academic institution should do. They should run a startup cell in which they provide incubation and support to the new healthcare startups. And another thing that we must involve both of these people, researchers from the academic institutions and the healthcare practitioner, to frame the policies related to healthcare. So these are the few points which I think that is necessary to have that new research and innovation in healthcare by joining the researchers, academic people and the practitioners.
Thank you, Dr. Komal. Dr. Manoj, coming back to tourism, and you spoke a lot about the number of tourists that have started coming in India post G20 and all of the events. We also recently saw the Mahakumbh, which invited a lot of tourists. Now, how do you translate a lot of domestic as well as international tourism and start utilizing healthcare as some sort of I wouldn't say some sort of an advantage for India?
See, this sector is growing in a very fast scale now. If you compare ourselves just 2 years back and now, uh, the sector has grown uh, to a very large number. We are expecting from 7 billion to about 27 billion in just another 1 year to 2 years of time. And taking advantage, like I share a case study, or many international delegates came here for the Mahakumbh. And the second thing which they have done other than the shopping and food in India is the medical treatments. The tourism, yes, they visited not only Mahakumbh, they went to Ayodhya, they went to Banaras, and some other places. Even some of them went to Agra. So the next step they were having, the main benefit which this industry has got other than the Mahakumbh was the medical healthcare industry. I have seen lot many patients. I will say lot many tourists, not these patients, who travel in the Mahakumbh. All of them have gone for a dental checkup and eye checkups. All of them. And when they go to the dental checkup, they compared the cost, and we are almost 1/10 as compared to their countries. So they not only took the dental and eye treatments, but we got many inquiries for the transplants, the cancer patients. They came here, and at the Mahakumbh they have seen the holistic healing approach also. Uh, Ayurveda, yoga. We as Indians are not very passionate about these therapies, but the foreign patients, they are very crazy about it. And if you go deep into south of India, where we have a lot of wellness centers, very old wellness centers, and they've spent a lot and lot of money in developing these centers, and those are world class center, nothing less than a 5-star hotel. And we have one center here which is close to my heart, is which Charya Manish ji, everyone might have seen in the YouTubes and all, hymns near Meerut. I have seen with my eyes, and I have actually given them a lot of, referred them a lot of patients. I have seen people uh, you know treated by them in just 15 days. I have seen people who are diabetic and now they are not taking any medicines in the diabetes. And even the cancer patient they are treating. Whomsoever is interested, I would like to share with them so that we can promote our holistic healing in India. And so this sector, not only in the domestic, yes, domestic. Every family has a patient, every family has a diabetic or a BP issue or something. We are actually not finding a good solution out of it. Our country is very rich in healthcare. I will rather say this in Hindi. आज से कुछ साल पहले ना कोई वाइट डॉक्टर का डॉक्टर होता है, आई एम सॉरी टू से डॉक्टर साहब, सो कोई वाइट कपड़ा पहने डॉक्टर नहीं होता था, कोई अपोलो जैसा हॉस्पिटल नहीं होता था. हम लोग एक जड़ी बूटियों से ही इलाज करते थे. संजीवनी बूटी सबके पास एग्जाम्पल है, हनुमान जी लाए थे और मूर्छित पड़े, लक्ष्मण जी की जान बचाई थी. वो सब खो गया है. एक बच्चा एक गर्म भिगोने में पानी में एक वाइट शीट में पैदा हो जाता था, कोई वैक्सीन नहीं हम उसको लगाते थे. ये सब जो है खो गया है. लेकिन ये सब अब दोबारे से सामने आ रहा है हमारे बहुत बड़ी वे में, क्योंकि होलिस्टिक हीलिंग with the command of Ayush and Heal in India project is growing in a very big way. So not only our sector is growing in the medical tourism sector, but overall the healthcare sector is growing. We are taking our doctors to these places deep into Africa and CIS countries. We are organizing OPD camps where these doctors are seeing those patients free of cost, and then we are giving them the solutions for their issues. And those countries, as I mentioned before, that they don't have good procedures available in those countries. कैंसर होता है पेशेंट को तो उसका पार्ट काट दिया जाता है, उसके बाद वो दूसरे किसी पार्ट में जाता है तो उसको काट दिया जाता है. तो दैट्स नॉट द राइट अप्रोच जब हमारे पास सॉल्यूशन है. And all these countries are also want Indian hospitals to set up there in those countries and help those countries. वो लोग हमसे मदद भी मांग रहे हैं. And this will not only boost the healthcare sector, but all these medical technology जो यहाँ पर बड़ी वे में exhibits कर रहे हैं. हम लोग टेक्नोलॉजी में बहुत स्ट्रॉन्ग हो चुके हैं, and we are strong in every sector actually.
Thank you so much, Dr. Manoj. Maybe we can take one or two questions. Yeah.
Any question from the audience? I think we don't have any question, so that's fine. So thank you so much, Dr. Nitiraj, for excellently moderating this session. And this was such an insightful session, and I believe our audience would have definitely gotten some key takeaways for this. So let's give them a big round of applause. Now it's time to acknowledge and express our gratitude to our esteemed panelists and our moderators. May I request Dr. Niti Raj to felicitate co-panelist, Dr. Puneet Tyagi. Let's give them a huge round of applause. Dr. Yu Shin Ko. Dr. Atithya SP. Dr. Komal Patel, Dr. Manuj Mittal, now I request Ms. Khushbu Sharma to please come on stage to felicitate our moderator, Dr. Niti Raj Gandhi, for leading this impactful discussion. Let's capture this moment with a group photograph. Thank you to all the panelists, and thanks again the sponsor of this panel discussion, Graphic Era Institute of Medical Sciences. Next, we have a special presentation by our session partner, Graphic Era Institute of Medical Sciences, bringing invaluable insights into the evolving landscape of healthcare. Now, I would like to invite Dr. Puneet Tyagi, Medical Director and Senior Consultant, Pulmonology, Graphic Era Institute of Medical Sciences, to take the stage for the presentation. Thank you, sir.
Good afternoon, all, and once again, I welcome you all on behalf of Graphic Era Institute of Medical Sciences. Graphic Era Institute of Medical Sciences, it is a new hospital that came up it became functional in 2021, and we are just 4-year-old, but we have grown by leaps and bounds in these 4 years. So this is the hospital, you can see, and it is based in Dehradun, state of Uttarakhand. It is a huge structure, and we started medical college also last year with intake of 150 students. And currently we have around 850 beds, and we have more than 125 critical care beds in this hospital. And basically, the basic aim was to connect whole of the Uttarakhand, not only whole of the Uttarakhand, but North India, whole of the North India. And so we have basically this vision was of Professor Kamal Ghansala, who is the chairman of Graphic Era Institutes and Educational Institutes. So this basically it started as his vision, and he started with a 10 by 10 room somewhere 30 years back, where he started his computer training center there. And he himself is from computer sciences, BTech, MTech, and PhD in computer sciences. And he started from that 10 by 10 size room, and now it has, in last 30 years, it has grown up like anything. We have almost 4 campuses for education. 2 campuses are in Dehradun, 1 in Haldwani, 1 in Bhimtal, and the 5th campus has come up with this medical school and hospital, basically. So then lot of this is Graphic Era Group is basically associated with education, placement, and research, and we are doing a lot of community outreach programs, and lot of startups are being done. In fact, one of the smallest ECG machine that was developed by the student of Graphic Era Institute only. And right now also we are having connection between the hospital and the university, because we are working on many patents, what doctors who want some new devices and the university is working on that. And this is a medical college. It's a 150. We have 150 seats now, and it started last year only. Then in healthcare facilities, we have almost all the facilities developed, and starting from emergency medicine, then we have a state-of-art cardiac sciences department, and we are doing around 100 angio, 100 to 125 angioplasties in a month, and we do around 30 to 35 cardiac surgeries in a month, apart from all other things. And we are a recognized center for TAVI also. Apart from that, other specialities that we have department procedures apart from spine and recently we started deep brain stimulation also, and we did our first patient last month who is doing quite well. Apart from 850 beds, we have state of art radiology Then these are some of the achievements done by us. We have done maximum TAVI procedures in Uttarakhand, and we did first ever renal denervation in Uttarakhand, first ever PDA stenting in Uttarakhand in 1 month year old baby. And it is only center in Uttarakhand independently doing POEM, that is per oral endoscopic myotomy, and first center to have a Arbe Vio3 quadri, and only center in Uttarakhand for EUS. So these are some of our, I think the sound is not there. These are some of the testimonials of our patients. So as part of our corporate responsibility initiative, Graphic Era Hospital is committed to adopting villages. And this we have done. We have adopted 4-5 villages in our surroundings, and we are taking care of them regularly. We provide them ambulance services, and whatever problems are there, we tackle those. And because we are Ayushman empaneled hospital, so we are able to provide care to all of the patients basically. So we have made these cards for the families, you can see. So where passport size photograph is put and the details are put, and our medical students, because we have adopted these villages, they go family to family and they fill these cards, and we track the patients, especially of chronic diseases, and if some problem is occurring, so we are able to diagnose them early and take care of them. So have provided service to over 8,000 people across multiple villages. These are some of the villages which we have adopted. We have been engaged in a lot of camps in the hills and in the nearby areas. Now, the highest number of blood is donated by Graphic Era University, because because we have around 40,000 students, and around 6,000 to 7,000 units are donated by the university students every year. That not only is utilized by our hospital, but by other hospitals and blood banks also. So this was our hospital presentation. Thank you.
Thank you so much, Dr. Puneet Tyagi, for sharing such valuable insights with us. And your expertise has provided a deeper understanding of how medical advancements are shaping the future of healthcare. And we truly appreciate your time and efforts of being part of this conference. And now, as we explore groundbreaking innovation in healthcare, one of the most transformative advancements has been the integration of AI and robotics into medical procedures. From diagnostics to surgical precision, technology has redefined how we detect diseases, treat patients, and improve overall healthcare accessibility. With this, I have a quick question for my audience. So let's get on our, kind of fastest finger wala, jo pehle jawab dega, and you all know the drill. The our gifts are ready, right? So the question is, in which year was the AI assisted robotic surgery performed? A 1995, B 2000, C 2005, D 2010. I need more hands. No. Yeah, one from. May I know your name? That's the correct answer. The answer is 2000. Yes, the first AI assisted robotic surgery was performed using the Da Vinci surgical system in the year 2000, marking a major milestone in minimally invasive surgery and AI driven medical advancements. So we have a short video of graphic era. Can we have that on? Side hat jao. Side hat jao. भैया side hat jao. उसको बोलो side हटने को. So that was about Graphic Era Institute of Medical Sciences. And now we'll move on to our next session of the day, technology driven healthcare role of AI and emerging technologies. Technology is revolutionizing healthcare, bringing unprecedented efficiency, accessibility, and improved patient outcomes. From AI diagnostics to wearable technology and cloud based solutions, we are witnessing new era of digital healthcare. This session will explore how AI transforming disease detection, personalized treatment, the role of digital health and wearable technology in preventive care, how cloud computing is improving healthcare accessibility. And we are honored to have a powerful panel of experts to guide us through this. Now, I would like to invite our esteemed panelists for this session. Dr. Jong Neng Ron, Chair, School of Medicine, National Cheng Kung University. Let's welcome our panelists with a round of applause. Dr. Moni Abraham Kuriakos, Co-founder, Medical Director and CEO, Karkinos Healthcare. Dr. Prashant Khadke, Managing Director, Hemex Health. Dr. Sushil Kumar Meher, Head of Health IT AIMS New Delhi. Dr. Kunal Behrani. So Dr. Kunal Behrani was supposed to join us in a previous session, but due to some emergency, he couldn't. So he'll be joining us soon. Clinical Director and HOD Neurology, Marengo Asia Hospitals, Faridabad. And now I would like to invite our moderator for this, Ms. Khushbu Sharma, Joint Director, Voice of Healthcare. Over to you, ma'am.
Good afternoon, everyone. Well, on behalf of Voice of Healthcare, I once again, from the bottom of our heart, thank each and everyone who's been a part of this conference and has been helping us to put together this show. And also, a very warm welcome to the panelists here. Dr. Kunal, as Simran said, would be joining us very shortly, and probably he'll join us directly on stage. Right, so we are discussing about technology. We are discussing about tech-driven healthcare delivery. Now, during the course of the day today, we've had a lot of discussions around how care delivery providers are using technology to make sure that there's end-to-end delivery of care. There has been a medical device panel that specifically talked about technologies such as next-gen sequencing, precision medicine, diagnostics accuracy, and making sure that AI is right at the center of it. And now we have this panel. So I think it's pretty much safe to say that we probably are witnessing the convergence of the healthcare and AI together. It's safe to say that healthcare and AI are pretty much a power couple currently. So we'll have to navigate whether they're still dating or happily married. So yeah, that's where we are. Talking about tech-driven AI, talking about AI and emerging technologies in healthcare delivery. Now, just to imagine stepping into a hospital where We do not see a doctor. We see an AI powered robot, which is assisted by probably a doctor miles away. I think that's safe to imagine. Uh, all of us moving around, just a remote chip monitoring us somewhere. That's also safe to imagine. And also in an era where maybe just getting our prescription basis on our DNA. I think Sir would agree. And this is something which probably would have been just a science fiction a few years ago, but here we are. So not taking further time, we'll be discussing everything and all things about healthcare, technology, AI, and emerging technologies. We have a very diverse panel with us, starting with Dr. Rohan, sir, you. Sir, you come from an education background, an academics background. Can you help us understand as to how currently medical institutions are using technology, are using AI-driven technologies available just to make sure that we're using end-to-end healthcare delivery, and how possibly we can take this road ahead? So over to you.
Thank you for that question. Everyone, I'm Dr. Ron. I'm from National Jingo University, and I'm a cardiovascular surgeon, and I'm also the chairman of the School of Medicine in National Jingo University. And for that question about the application of AI, as an academic leader, I would like to propose that 8 points to that question, and which could be a mnemonic phrase. That is the tips for data joining. The tips, TIPS. The T meaning the targeted training. We developed the training programs for medical staff on interpreting AI enhanced CT images, and to facilitate seamless integration into clinical practice, especially during the era of COVID-19 that with the aid of AI, we screen the check X-ray to identify serious pulmonary diseases. And I represents for innovation labs, which means the establishing the innovation hub within medical institutions to refine AI applications in real time collaboratively. And the P indicates the pilot program. We implement pilot initiative to integrate AI technologies to radiology workflows to evaluating their impact on patient outcomes. So some of our colleagues have some publication using the AI to assist in the X-ray or CT image for diagnosis of pulmonary diseases. And S represent the showcase success. We document and promote successful case studies in AI applications like the CT imagings, etc. Like we will present today in our booth, that how we use the CT image to identify the ground glass opaque materials for lung nodules. And the F, feedback mechanism. We create structured feedback loops to clinician and AI tools to inform the interactive improvement and ensure the continued relevance. And regulatory collaboration. We partner with tech innovators to effectively navigate regulatory pathways. We have a strong team of engineering that we collaborate with each other, sharing our mind about how medical part we're thinking of, and the engineering will try to cooperate their ways to improve the AI application. And the data utilization is most important. And in Taiwan, we are almost over 99% of the people were covered by the national health insurance, and we have a large database. And as far as I know, that actually India, you should have the most largest database in I think. And in Taiwan, we have the database, and we make the best use of the database with the assistance of AI modeling to improve the outcome from the insurance. And the last thing is the joint research initiatives, like today that I come here to find the Indian collaboration. And we collaborate on research employing AI for CT imaging, all kinds of imaging processes using the real world data from our national health insurance with the database to enhance the diagnostic accuracy. So these strategies are effectively collaborate with medical institutions and technologies to innovators to faster adoption of advanced healthcare technology. And also one thing that I would like to mention is that as a chairman of the school of medicine, we also incorporate training. We used to train our medical students to be physician scientists, and now I will bring in the concept of physician inventors. Now we need more inventors to improve the clinical outcome, not just scientists. Just like Dr. Giulio Palmas, who invented balloon expandable coronary artery stents, actually saved a lot of lives. So that's my comment about your question. Thank you.
Thank you so much, Dr. Wan, for that. You also mentioned 90% of your people are already covered with the national insurance. I think that's a good number to have. You're still struggling our way through. And you correctly said that we have a large number to cater to. So I think we'll get through that. Dr. Moni, coming to you, sir. Now, sir, he did talk about imaging being used as the center of how the technology has been driven at the Taiwanese institutions. So, representing Kakinos, where I mean, we already know that you're using a very specific technology-driven model for cancer detection and for many other disease-specific areas. So, can you help us understand as to how you could place technology at the center of what currently Kakinos is doing, and so as to the way forward of how we can take this through?
Thank you, Kushbu, and good afternoon, ladies and gentlemen. See, if you look at cancer care established anywhere in the world, we treat cancers in major cancer centers. That was the model which was established over 100 years ago. And we in India also adopt the same thing. That works when there is a cancer was a rare disease. Now, 1 in 9 of us will develop cancer in India. If it is in a developed country, it's about 1 in 4. So we're going to get that number. Second problem what we have is that I was the director of a public cancer center. Over 70 to 80% of patients coming to us in major cancer centers are in advanced stage. The main reason is that primary care who's supposed to diagnose cancer do not get diagnosed cancer. So these kind of apex cancer centers are good in a Western country where it's a very robust primary care setup, but in our country it fails. But we are good at it is technology. If you look at how technology adopted in fintech or travel and everything, we are quick in adopting technology. So Karkinos, during the last 4 years, we have established a tech model where we touched every touch point of a patient's journey, right from screening. Next, we need to make the appropriate diagnosis. Third, we have to make a decision making. And fourth, delivering the cancer care close to patient's home. And finally, we need to coordinate the care. So what we have done was we established a risk assessment model to see whether you and I have a risk of developing cancer. Why we are doing that? If you look at the national NCD screening program, 0.02% of the population undergo screening. Screening is not a cost-effective method. However, if you identify at-risk population, then we can select the screen. So we ask this 80 odd questions, identify the high-risk population, move them to what we call community cancer clinic. See, community cancer clinic are established in existing hospitals. That is where the patient go with the symptoms. That is where doctors do not diagnose the cancer. So we develop we call community cancer clinic. This is a tech-enabled clinic where the patient walk in, they can go through a structured way of screening for 4 or 5 common cancers. Now, once the cancer is diagnosed, next aspect is the decision making. Last panel, we spoke about telemedicine and so on. This is most appropriate when it comes to cancer. Cancer is no longer a one doctor's decision making, a team effort. Now, that is rarely practiced. Now, in a technology-enabled era, we can make the quick decision making where before the go to a apex cancer center. Now, once a decision is made, then that we do a virtual tumor board. Then we can do something called command center we have established, then navigate the patient to the appropriate place for treatment. For example, large number of patients can be treated close to patient home with chemotherapy. For example, the last budget, the government proposed about 200 daycare district chemotherapy centers. This is if you pre and post integrated that will be a very effective method so that care can be given close to patient home. During the last 4 years, madam, we have risk evaluated over 3 million population. 12% of there was found to be elevated risk. Over 65,000 patients were coordinated the care in a distributed fashion. This is feasible in a tech-enabled era.
Right, sir. Thank you. Thank you for that. Moving on to from the diagnostics end to the care providers and Dr. Kunal. Dr. Moni just said that cancer is no longer a one doctor problem. We are still navigating the way through for that. Sir, for you, how, according to you, can an interdisciplinary approach, right from the care providers, merging with the diagnostics providers, to also the delivery solutions there, to medical devices providers. So how, according to you, can an interdisciplinary approach at the center help the patient centricity to come in the center and just bring the system to being more resilient? Over to you, sir.
Thank you. So, see, I am a neurologist by profession. I am right now positioned as a director of neurology at one of the corporate Panangvesh hospital. So I'm into this practice for last 15 years in the neurology practice, and I've seen now centers where the stroke excellence is growing day by day. So when I started my journey, the stroke, which is very common problem in the country, every year somewhere around 1.5 million cases we see every year. So when we started my journey, so there used to be a limited number of staff, limited number of doctors were there when they used to give a proper treatment, proper care to the patients. And also at that time, the stroke awareness was not there. Today I can say when I with over the time that now the stroke excellence program that needs a multidisciplinary approach. So rightly you said, how can we improve that to give the proper care to the patient? So over a time, what I have done is, so I have built a networking system, not only in hospital as well as the intra-hospital also. What I have done is I have started doing the community awareness program. People started knowing about the symptoms of stroke. Now they are coming with the stroke symptoms. They get to know, they are providing it on time. So I have built a stroke pathway in our hospital also. So what the stroke pathway is, not only the neurologist, but at the same time, there are multiple stakeholders. The stakeholders include not only the neurologist, therapist, the physical therapist, occupational therapist, speech therapist, nutritionist, all these stakeholders have a one goal to provide a comprehensive stroke care to the patient. Now a patient comes to our hospital, we have a fast program, we have a stroke program. So everyone knows his domain of work. And at the end, the one motto to give the excellence to the patient. And we have seen a changes. Nowadays, when we are committed to our service, the patients, it turns a better management, and the patient goes happily also with all the service providers which we provide.
Thank you. Thank you. I think with the end goal of making patients satisfied and bringing the patient centricity towards the focus goal is the right key. Dr. Prashant, coming to you, Dr. Moni did talk about diagnostic solutions and how we are making, for example, cancer care, more screenings are available, and then how we are making sure that we are there through his community programs also, where he mentioned. But for you, Dr. Prashant, since you're representing the diagnostics industry as well, I would also like to understand the usage of technology as per your domain, and also how are you making sure that it is going through specifically to the resource limited settings, just as to make sure that the screening and diagnosis is towards the last mile. Over to you.
Thanks. First of all, very good afternoon to all. Good brainstorming session. Thank you all. So, as far as diagnostic is concerned, I think tracing, testing, and treatment, all these three things should be considered for a holistic approach. And if you look up India, it's a big, very vast country, very populated country. And if you see, the major problem is the scanty data. If you look any disease code, we don't have a data. Even if government want to plan something, they need to allocate the resources, they need to allocate the funds. Unfortunately, the data is not there. So where I feel AI will definitely help, both AI ML, to have a systematic data so that the policymakers, admin people, government people, they can allocate the resources, they can allocate the fund, and the things will happen more efficiently. Now this is, when you're talking about the big public and all, because the data is the oil. Without data, you can't proceed. And if you go traditionally by having something, putting it on the paper, so analysis, statistical analysis become a next challenging job. So I think AI is really helping. So particularly diagnostics, if you see, I believe that democratization is very much essential. Earlier days, diagnostics used to be just focus or concentrated to big core labs. That could be possible for certain diseases like a cancer, but for the other diseases, non-communicable diseases, the public health has to be empowered. So there could be a many point of care devices or something which could be AI enabled. So that will reduce the dependency on the expertise like a pathologist or like a hematologist. That doesn't mean that AI will cannibalize the role of doctor or expertise, or AI will replace the doctor. I personally feel that the AI will empower them. AI will help doctor to take decision more precisely, more quick, more fast, because more number of people are there in India.
Right. And I think it's safe to say here in the gathering of healthcare professionals, AI is never going to replace the doctor. But I also heard that it's going to replace the doctors who are not using AI and technology. So I think, yes, coming from a panel here, it's safe to say that. Dr. Meher, to you, sir. Um, now, all of our panelists did talk about democratizing the data. Dr. Prashant also mentioned about how vast the data is available currently. But with the huge data becomes a huge responsibility for us also to manage that data so as to make sure the patient privacy also keeps intact, the patient care also keeps intact. So, sir, for you, with the rise of digital health records and cloud platforms that we have currently, what measures should be prioritized to ensure patient data privacy and cybersecurity?
Anyway, good afternoon, everyone. I am thankful to viewers for inviting me in such a wonderful event. I'm Dr. Sushil Meher. Last 32 years, I am working in IT in healthcare. And last 20 years, I'm working AI in healthcare. So I have a lot of AI projects which has been already been implemented across the hospitals in AIMS New Delhi. The topic which you just given me, it is a huge topic. I have to categorize this. I will tell. Then I will tell you. Data is one of the most important in the healthcare. With small definition, you take it from AIMS. More data, more healthcare. Less data, less healthcare. If you want to be your health to be treated accurately, you need more quality and quantity of data, which can help you to get a quality of healthcare. AIMS is not a hospital, it is a center for healthcare research. Research means you need data. And I hope, I do not think so in the country anybody has that much of data. We are 27 petabyte of data. And all are available for the researchers. Now we come to two things I'll tell you. One is the healthcare privacy. There are three important points is there. Security, privacy, confidentiality, it is required. And for this, you need a governance. Governance means there is GRC, governance, risks, and compliance. These three components has to be available if your hospital is digitized. The governance, I do not think any hospitals they have a plan for a governance of their own data. We are struggling basically that what governance supposed to be applied on the user data. The basic definition of data used by the doctors is that you have to understand the one point: who is the owner of health record? Many people's they have different perception, but as per rule, the patient is owner of the health record, and the hospital is the custodian. There is a mutual agreement between two that I am keeping your records. I am giving confidence to you to it not to be leaked to anyone without permission from you. And when is it digitized? Digitized means the data is placed in one place. It can be shareable by many people. And you need a proper governance. Based on that governance, you put your application software to inbuild. Which is, if the governance program is not there, how we can decide that this record will be accessible by whom? That is the one of the main things people should understand. For governance cases, government has already been a act. It is already been implemented. That is EMR Standard 2016. You please go through it. You will understand there is a lot of things it is given. What is the governance? What is the cybersecurity, confidentiality, and privacy? All this it is mentioned there. So this is my thing is that if you want to have a digitized, you're supposed to compliance as per the given by the government of India. Now DPDP has come up, and many people stay confused. And this DPDP document is not as per our healthcare service provider. Before that, there is another act that has come for the public domains, but it is not been passed from the parliament. That is DISA, Digital Health Security Systems. It has been come up, but due to this DPDP document has not been approved, that's why that document has not been carried out. Now DPDP will be implemented. After that, DISA will be modified, and that will be implemented across the hospitals. And third one, the last one is the cloud. Many people they are going to the cloud. They are giving a SaaS is a model, but right now what I will tell many people, they are going to the cloud. Be careful. Cloud is more vulnerable. Many people they think that cloud is more secure. No, you are out of your hand and you are putting the data in somewhere else, and when you are assessing that, you are from the outside taking a channel to assess the data. That is the more vulnerable. So that's why before going the cloud, you have a clear assessment what you are doing and what kind of security system being in place. Thank you.
Right, sir. I completely get. Coming from an institution such as AIMS, which needs no introduction, I'm sure, sir, that there has to be a lot of challenges when it comes to data management and data privacy. And you strongly said that there has to be a responsibility, a sense of responsibility when it comes to a lot of data management. Dr. Ruan, to you, sir. Now, we've been talking about what technologies are supposedly to be introduced currently, or what are we using currently. But also with that, do you think that there are any specific set of challenges when it comes to introducing a new set of technology to, let's say, a hospital or a medical institute like yourself, or a clinic for that sake? What is your take on it, sir?
Yeah, just like the novel, the Twin Towers by Dickinson, it says that it's the best of time, it's also the worst of time. And we have very promising future in medicine, and we also have challenges. And I also categorize into 8 points. First is that the maintenance and support, because of the ongoing operational support in new technology. Actually, we have limited budgets, and that was the limitation in developing that. And the second thing is that demonstrating the efficacy, especially the security we are just talking about, and so that demonstrating how the clear benefits of using the AI, we still need some more evidence to prove that, and that is the new challenge we have. And of course, the other point is that the financial constraints I have just mentioned about that with the constrained funding, that hospitals may struggle to afford the latest technologies, especially the firewall we need. Indeed, that we have to protect our data. Anyone can hack in the data. That would be a very, very great loss out of our imagination. And that also needs a budget. And the other point would be the resistance to change. Although maybe few people, but still have people that, given the budget limitations, that some of our healthcare staff may be more resistant to adopting new technologies about that. And the fifth point is that the regulatory challenges. The regulation usually go much slower than the technology development. So maybe some of the great challenges will be holding on by the regulation from the government or the state government, etc. And the sixth point is that the integration difficulties. We have limited financial resources. So talking about the existing electronic health record systems, how to integrate that with patient care, that is also could be a problem about that. And the same point is the training and the education. That the technology is going so fast that we need more training, new training about to accept that new knowledges. So there's always a knowledge gap about the new AI development and the medical practices. And the last thing is that the data privacy concern, as we always are talking about that the privacy is the most important thing. So we do have some people that don't like to share their own data, although we urge people that we need more data to show that the effectiveness. But privacy is still, the major concern about. So that these are the future challenges. So our Taiwanese medical institutions might consider strategic partnership with academia and the tech innovators to share resources and to utilize the pilot projects to validate the cost effectiveness and the government support or grant focusing on the digital health initiatives. So on behalf of my institution, we urge the enhanced collaboration between institution between Taiwan and India to face the challenges together. Thank you.
Understood. Thank you, Dr. Wan. Dr. Moni, sir, for you. Now, in the first round, sir, you did talk about how Kakinos is specifically using technology and AI for cancer detections. But with that, and Dr. Ron also stressed about one specific point, which is financial constraint. Sir, in your perspective, how, according to you, can we balance the tech-driven management of a disease such as cancer, screening of cancer, with affordability as a problem in India?
Kushbu, the technology what can really better is access and affordability are the problem technology can immediately address. Now, if you look at the cost of cancer care, what drives the cost of cancer care? One is innovation. I'll come to that innovation solution later. What is more important is what is the standard of care, whether it can be made available to, accessible to ordinary people in the community. I'll give an example. We work with NGOs, government, and so on. We worked with a PHC or district in Idukki, a small village, population about 65,000. During a 6 weeks period of cancer control, we trained their health workers, then used the infrastructure, then they screened that 65,000. Out of that, about 40-odd thousand patients we could screen. About 200 cancer or pre-cancer we could identify, and then we could coordinate the care. So this improved the access and then affordability. When it comes to affordability, almost 60% of the cancer care cost is out-of-pocket expense. If we can give the care close to patient home, we can bring the cost down. Now, the second, when it comes to innovation, we are not a discovery entity, but we support discovery. I'll give an example. We work with the IIT Madras, developed the Bharat Genome Atlas project. That is driven by, because out of that 65,000, we collect sample with appropriate consent. We work with the IIT type of entity to genomic type of discoveries. So that led to almost 40 different panels, which can be made affordable for almost like a precision oncology treatment. My area of interest is oral cancer care. We heard about the impact of data, and then how the regulatory framework for India. Now, if you look at the oral cancer detection, if a specialist go to the community, we can diagnose with almost 80% accuracy. Now, I cannot send a specialist there. We have developed a probe where which image can be detected, and because of the power of the number, we can brought in the AI technology. We can get a diagnosis almost as good as a specialist, about 80% accuracy. So this is how we can empower that. So technology definitely will improve access as well as affordability.
Sure. Thank you, Dr. Moni, and many congratulations on the collaborations with IIT Madras. These projects are probably the need of the hour that we are currently catering to a population that's going on, sir. We did talk about affordability, accessibility, but what we can't leave behind is the care delivery and the care providers, the hospital infrastructure. So what measures can hospitals take to enhance patient trust, first of all, and also satisfaction while maintaining operational excellence? And all of this, we're talking about keeping tech integrity in the center. So over to you, Dr. Kunal.
So to start with, I will just quote a figure. I think many of you might be aware also. Last year there was a study done by the published in the International Journal of Stroke. So it was a study been done in our country only. So that study clearly mentioned somewhere around there are hardly 565 odd number of stroke centers in our India. And out of which with 560 centers, most of the centers are primarily located in the south and west, and hardly 50 to 20% are there in the north zone. And more surprisingly is hardly, so somewhere around only 20 to 25% of the Indian population are accessible to those stroke centers. So why it is so? Why the only 25% Indian population are accessible to those stroke centers? Probably the reason being we don't have so number of stroke centers, and also at the same time the distance between the population and the stroke center is too large. So how we can improve this, and how can we improve the stroke care? So what we have started as a neurologist, what I have done is, so I have started leveraging the AI. So because a lot of time we now use this AI term, how we can leverage the AI in healthcare. So what I have started is, I started collaboration with some projects with help not only in the diagnosis, but also the treatment, also in the prevention part. So what we started the diagnostic part. So we have partnered with the Medtronic people with the rapid software. How it does, so whenever a patient comes with the stroke symptoms, sooner we get the scans, immediately the scans gets transferred to me by the image, by that software. Immediately we get to know whether it's a large vessel occlusion, we immediately go down to mechanical thrombectomy. So that is leveraging the AI software, by which we can diagnose those cases in the early stage. How can we treat? Not only the traditional treatment, not only the traditional we doing the thrombolysis, mechanical thrombectomy, but over and above, now we are using the AI. So something like brain-computer interface. Now we have started leveraging. We are into. I'm a co-PI with one of the Mary software also, Mary company. With we have a project with JNU also. So what we are doing is we are using those softwares, those rehabilitation techniques like the hand gloves. We are into one of the multi-centric study that is using the hand gloves. That is a robotic software which helps in the hand improvement in the hand functioning. And moreover, now coming to the prevention part, lately we have started a multi-centric sort of study where we are just doing what we are doing is we are making a model with the CT scans. So the patient who are coming with us simply with the problem with the headaches, we are doing the CT scans. Now with those model, with those data, we are creating a model where we can predict the risk of stroke over a time. So this prediction model we are doing with the AI. So this we have partnered, I'm a co-PI with the Marriage software. So that we are building. So that is the way out. I think leveraging such technology not only help in the diagnosis, prevention, but also to treat. So I think now it is a time where we can leverage those technology which can help in the early improvement and early treatment.
Right, so thank you, Dr. Kunal. And with Dr. Moni saying a collaboration, and now, sir, you stating, I think, again, collaborating with companies such as Medtronics or JNU for that matter, and so collaborate with IIT Madras, collaborating for tech-based innovations just to ensure timely screening and to increase the number of screenings and diagnosis catering to the population that we have is the key. Dr. Prashant, sir, to you, since the topic is hot for affordability, availability, and also as to understand what steps to be taken just to take this to the last mile. So what is your take on bringing all the affordability into measures, considering the resource mobilization that we have?
Yeah, thanks. I think this is very realistic question. Affordability is the most important thing. And as Dr. Moni said, that if you look at the last miles, our health system is decentralized. If you talk about the public health system, district hospital, sub-district hospital, CSC, PSC, and sub-centers. So am I enabling my PSC, am I enabling my CSC and sub-centers for certain kind of diseases? And if you look at the cost is not only from either government side or from the lab side. Cost is also from the out-of-pocket from the patient. Now what is happening for the most of the diagnostics, patient first coming giving the blood for the diagnostics. Then again he has to come for the taking the report, and then again he has to come for the taking the appointment of the doctor. And most of the times, the rural people will not have this much time. They are not that much bothered. For them, illness is the important, not the wellness kind of thing. So then logistic cost. For an example, if, am I shipping my consumables in a cold chain, or are they, room temperature for India and room temperature for any European countries is a really different thing. We feel that living in Delhi or Mumbai, 40 degrees Celsius is a room temperature. Practically 20, 22 degrees Celsius is a room temperature, where the most of the consumables will not work. So I'm happy to let you know that, as sir said, a discovery part, here in the HEMEX, we have discovered the world's first microchip-based electrophoresis system, which works at a room temperature. And I'm happy to let you know that for the particular government of India, as our Honorable Prime Minister launched Sickle Cell Mission Program, so we had been the first one to actively participate in Odisha state. Now that state is considered as a Odisha model, where we have screened around 1 million patients in 1 year, and every data is digitalized there and there itself only. So I am not talking about the time. We always say TAT, turnaround time. So turnaround time is not for the test. Turnaround time should be for the result. If you are able to give the result there and there itself only, the patient will feel empowered. Doctor will also feel the empowered. So I think technologies around, or maybe with the help of AI, digitalization, these things, all these points need to be addressed. It's not only a technology, but am I really reducing the burden of pathologists or hematologists or whoever is the expert in that area? Because if you look at the India, I'm talking only about the India, there is a 1:10,000 proportion. How far the medical colleges will get open, how far we will empower. We may not able to this, mathematically grown ratio with the geometrically grown population. That inverse proportion will be always there today and tomorrow. So I think we really need to understand till the last mile. Means it is not only diagnosing the patient, but processing the data, analyzing the data, allocating the resources, and then starting the treatment. Nowadays, companion diagnosis is more important. You take any disease, whether it is non-communicable disease particularly, disease management is more important. First one is definitely diagnostics, but once it get diagnosed, you have to manage. You take any lifestyle disease like a diabetic, it is more about management. Like thyroid, it is more about the management. Any genetic disease like a sickle cell, thalassemia, it is more about the management. It is next to impossible to get a complete cure from the disease. For that management, am I developing something? There are some, disease monitoring tests. So we always feel that, diagnostics should happen once in a life kind of thing, but it is not like that. Say, for example, HbA1c, you have to monitor your A1c throughout the life. So these things has to become, and I think affordability will definitely happen once the scalability is there. So these things go hand in hand.
Correct. But Dr. Prashant, as you said, thyroid management has to come hand in hand, and sickle cell management has to come hand in hand. We are still trying to figure out a way where we are managing illnesses currently. So I think wellness tak to धीरे धीरे पहुंच ही जाएंगे. Correct. Dr. Meher, sir, we come to you with all the problems. Earlier, I said about cloud and data management and how we are managing it. And now I just want to understand about automation. Do you think, or possibly how far have we come when it comes to automation in optimizing healthcare infrastructure? Or maybe if you could give some examples on how AIMS has set the benchmarks for technology-driven healthcare in India, considering automation in center.
AIMS really never been in lacking in the technology. Okay. Because from the 1965, they have started using computers. And right now we have supercomputer at our place. But when we are talking about the automations, automation is the first priority because 16,000 patients in the OPD in a day, it is not so easy to manage manually. We have seen that what is the trend from season to season, what kind of patient is arriving. That forecasting is done by AI. And based on that, the infrastructure is ready, the doctors are ready, and health workers is ready to handle this disease. Second part is that we have seen that around 36% of the people, when they have taken an appointment, they are landed in a wrong department, wrong specialty. So in that cases, what we have thought it, we have then got the bot-based appointments. That bot is guiding to the patients that which department has to take the appointments, and the appointment will be done through the bots. It is very easily. Third part is that patient empowerment. When the 16,000 patients are coming, and at least one or two people are there with them, means 50,000 in one floor, how to manage it, you see it. Then what we have done it, we have done the empower to the patient. Don't come to the counter. Use our Wi-Fi. This is the QR code. You scan it, put your appointments, do the registration yourself. Room will be allotted, time will be allotted, and that time you go to the rooms and show to the doctors. So these are the empowerment we are given to them. Right now we are going to start it that when you come to the hospital, if you need a wheelchair or stretcher, or you need a parking slot of your car, that will be done through your appointment systems. This kind of things. Because first impression when the patient will get, definitely will get the confidence that they will get a good kind of treatment. This is the automation at this level we have done it. Second part is, first time in the whole Asia we have installed robotic labs. Only the manual system means you collect the blood manually, test order will be done manually, rest of the process is totally automated. Even reporting is automated. Very few specific, when the AI tools mention that it is a unbelievable range is coming, so in that case doctor intervene, otherwise everything is automated. These kind of things, that's why you are getting the load. I want to give you one example to you, that it is the unique things, it is made in India, you can say. Cancer is one of the main death threat for the Indian citizen right now. Earlier it was the heart attack. Right now it is the cancer. That one day we sat with the one of the renowned oncologist, Dr. G.K. Rath, and he has called me that what we can do to put the technology on oncology. Then I've thought, then I've given presentation to him. Then first of all, we have seen the data that breast cancer and ovarian cancer is the most threatening throughout country, because we have analyzed more than 3 lakhs patients which were admitted there, and we have seen the trend that this trend is going up. So the only things you have to prevent that, can you do early detection, then 90% your problem will be solved. Then I went through the literature and have searched it, I got it. Then what we have done it, we have collaborated IIT Delhi. This is one good news I will tell you, if those are in the newspaper. We are the Center for Excellency in AI in healthcare in the country. And we have got 300 crores 2 months back for AI in healthcare to AIMS New Delhi, and this will be spent with the collaborative of IIT Delhi. So many projects is lined up. This project is a very unique project which I am talking to you. If you detect the breast cancer, how will you detect it? You need a mammography. And how many places mammography is available? Even many big towns, you will not find mammography. And the second part is that any disorder in the breast or any symptom is coming, the females are not ready to share this thing to anybody. So that's why the only way to connect with them is ASA worker, because they are working in the village. So we have developed that thermal scanning bra. You can search in the Google thermal scanning bra, you will get the photographs also. So what they are doing, the ASA worker is going, they have a smartphone, they'll take the all clinical information. If they found there is some chances is there, it may be. So in that cases, she will ask to see, please wear this thermal scanning bra inside your room and come. After wearing that bra, then one cable is backside, it is there. He'll put this cable to her smartphone mobile. and take the scanning of the breast. And there is a lightweighted AI tool. This is there. It will give the information that there is a chances is there. Then after that, they will recommend to go to a nearest oncology center for the further checkup. This is the things it has been done. It is done in the Punjab, it is done in Karnataka, it does in Tamil Nadu, some of the district in Odisha, Bihar, some of the states district in UP, and it is more than 75,000 data, and the accuracy rate is more than 80%. So this is the in-house, means inbuilt in our country. And this thermal scanning bride is coming commercially very soon. It is in the production levels. People are working on this. Thank you.
Right, sir. Thank you so much. I'm sure that a day-long conference would also be less to just talk about technology in healthcare, but here we are towards the conclusion of the discussion. But before we go, and being from the organizers team, it's pretty skeptical for me to extend the discussion. But just last one segment, I'd just like to ask one quick questions to all of you all and request one-word answers, whatever comes to your mind, just to end the note on a positive high energy. Dr. Rohan, for you, what is one technology that, according to you, will revolutionize medical education in the coming years?
Well, for student education, you know, I just want to tell it's the most difficult part is how to tell right from wrong. So I would prefer, I would like a machine that could tell us the right question, the right answer.
I'm sure the students in the audience would agree to it. Dr. Moni, for you, sir, if you have to describe the impact of AI in oncology in just one word, what would that be?
Empowering the health workers.
Correct. Thank you. Dr. Prashant, what is that one innovation that, according to you, will make diagnostics truly accessible to all? Just one word answer.
I think confirmatory point of care test, which will bring diagnostics within the reach.
Thank you. Dr. Meher, in a world driven by cloud-based data, and I know you're not very affirmed of how we are putting our data on cloud, but in a world where we are driving towards cloud-based data, what is that one non-negotiable privacy measure, according to you?
Yeah, it's a very difficult question. In the healthcare, if you talk, that privacy is one of the main issues which is supposed to be addressed, and the data governance is one of the part that they will take care of that. Yeah.
Thank you. Thank you. So for you, if technology and healthcare were a power couple, and I took this in the start also, if technology and healthcare were a power couple, what would be their relationship status? Will they be happily married? Will they be still dating, or is it complicated?
I think it will remain a loving relationship rather than marriage. Everlasting.
We would love to have it all. With that, this is the conclusion of the discussion. Thank you so much to all the panelists.
Thank you so much, Khushbu ma'am, for excellently moderating this session. Now it's time to acknowledge and express our gratitude to our esteemed panelist and moderator. I request ma'am to please come to felicitate our speakers, starting with Dr. Jun Neng Ron, Dr. Muni Abraham Kuriakos, Dr. Kunal Behrani, now I would like to invite Ms. Pinky Saha to please felicitate Ms. Khushbu Sharma for moderating this session. Now let's have a group picture. Let's have a round of applause. Thank you. That was an insightful discussion on technology driven healthcare and the role of AI and emerging technologies. Our panelists have shed light on how artificial intelligence, digital health solution, and wearable technologies are transforming healthcare delivery, making it more efficient, accessible, and patient centric. Now, as we move forward, let's shift our focus to a topic that is just as critical: healthcare's human touch. While technology plays an integral role in modern medicine, it is the healthcare workforce, particularly nurses, who serve as the foundation of patient centered care. But before we begin our final session, let's test our knowledge about the nursing profession and its contribution to global healthcare. So another fun question for our audience, and I need maximum participation because this is the last chance to win this prize. Which country was the first to introduce formal nursing education? Option A, United Kingdom. Option B, United States. Option C, Germany. Option D, France. Ma'am, you would already know that answer. So. Ma'am, yeah, I would like to know from you. Yes, ma'am. I don't think that's right. Yes. I got the answer from here. It's United Kingdom. May I know your name? Thank you so much. It's the correct answer is United Kingdom. The formal nursing education was introduced in United Kingdom in 1860 when Florence Nightingale established the first professional nursing school at St. Thomas Hospital in London. This initiative laid the foundation for modern nursing education, shaping the future into what it is today. So this brings us to our next session, a conversation dedicated to evolving role of nurses in healthcare and the leadership opportunities available to them. As we approach the final session of the day, we turn our attention to a topic that truly deserves the spotlight: the evolving role of nurse in shaping future of healthcare. So for this session, I would like to invite our panelists for the day, Dr. Sameer Singh, Group Medical Head, CK Birla Hospital Private Limited. Let's welcome our panelists for the round of applause. Dr. Raminder Kalra, Principal cum Professor, Holy Family College of Nursing. Ms. Vijay Varghese, Hospital Director, Manipal Hospital. Brigadier Dr. Ram Murthy Sharma, Medical Superintendent, Sharda Hospital. Ms. Neha Gupta, DGM Operations, Graphic Air Institute of Medical Sciences. And the session will be moderated by Ms. Bobby Ramesh, Group Director, Nursing Excellence, Sarvodaya Healthcare.
Good evening, everyone, and welcome to today's panel discussion on Nursing in the Spotlight, Shaping the Future of Healthcare Delivery. I'm delighted to be moderating this session, which brings together esteemed experts to explore the pivotal role nurses play in transforming healthcare. As the backbone of patient care, nurses are not only adapting to rapid changes in policy, technology, and patient needs, but they're also leading the change in redefining how healthcare is delivered. Before we get started, let me ask a question to the audience. How many in the audience feel that in our country, nurses are really in the spotlight, shaping the future of healthcare delivery? Very much I could hear an enthusiastic voice there, but only few have raised their hands. So today's session will be delving into the challenges, innovations, and opportunities that lie ahead for nursing who are shaping the future of healthcare delivery. My first question: would be to Dr. Aminder Kalra, Principal cum Professor of Holy Family College of Nursing. Dr. Kalra, nurses are increasingly taking on more advanced roles in healthcare. How do you see the expansion of nursing practice impacting patient care? And what further roles do you think that nurses could play in future to enhance healthcare delivery? Over to you.
Thank you so much, and Bobby, and it's a pleasure to be here. When you ask about the role of nurses, we have seen over decades how it has changed widely. It is not just, if you talk about to a lay person, they say nurses are the one who are going to give a pill to a patient who's sleeping to give a sleeping pill. Giving more of medication and injection is one, which is a broad thing, but it is not just not limited to it. Nurses are the one who are working in all healthcare setup. Whether we talk out at the community level, we have heard previous speakers also talking about so much to be done in the community. You are going to get the basic things done in the community to prevent, to identify, and even for the curative services, they may go, but a lot of diseases are being managed at home. The rehabilitative, a lot of things to be done. So we have under Ayushman Bharat also the community health nurse officers posts being created. They are the ones who are guiding the ASHA workers. They are the ones who are providing community health services at grassroots level. And not only that, if we see on the other extreme, we have nurses now becoming CEOs of the hospital, nurses now being the board members in the hospital. And I think if nurses are not there, no hospital can run. So it is a wide role. When we talk about AI, we have a lot of people who are in nursing also taking up the projects in AI. What are the needs of the patient in the hospital? The predictive analysis, whether we talk about or we talk about nursing diagnosis and management, we have a lot of studies being taken up by the nurses on how AI can be integrated into healthcare setup. We have nurses being trained in AI who are being sponsored by the hospital to go into more of digitalization. On the other side, we have another role which started long back, decades back in USA and Australia. Now we have nurse practitioner courses which have come into India. They are the ones who are with more of independent role of diagnosing, with more of diagnostic abilities being developed, with more of prescriptive rights for the different types of the medication. And it is not only in one area. We have nurse practitioner in critical care area. On the other side, we have nurse practitioner in family health also, who are going to work in the community. Everybody doesn't need to go to a doctor. There are a lot of health services which are being provided by nurses. So these are different roles. There's no end to the long list. AI, driven surgeries or robotic surgeries cannot be done without nurses being there. No patient can be taken care of without the healing touch by a nurse. Without the skills of a nurse and without a heart of a nurse, the patients cannot be provided care.
Thank you, Dr. Kalra, for those insights. And I'm sure the nursing practitioner courses which have been rolled out recently, they'll empower not only the nursing community, but also it will bring about a lot of improvement in the patient outcomes. My next question would be to Dr. Samir Singh, Group Medical Head of CK Birla Hospitals. Dr. Samir, looking ahead to 2030, what are the key trends that will change the future of nursing?
So good afternoon, everyone, and thank you, Bobby ma'am, to have us here. So I think taking a lead from what Professor Kalra said, and I'm the group medical director. So one of my ex-colleagues and classmates asked me, what are you doing in a nursing panel? So I'm coincidentally also the nursing director. Uh, my 50% of time goes into, I think, nursing services, because that's the solution to my remaining 50% of the problems. So in 2030, I see what she said is a very specialty, super specialty segment of nurses coming out. So you have a diabetes management nurse. I don't have to have an endocrinologist 24 by 7. He just needs to come 5 minutes, and the remaining 23 hours, 55 minutes, the patient is under the care of a diabetic nurse, not just the diabetes educator. So similarly, I think the second one trend, what I could see is, of course, the nurse practitioners. Those titles needs to change. I think the world is trying. The Indian healthcare is trying to move towards physician assistants, but we are trying to move now towards nurse practitioners. I think those courses, those I think change of designations, and it comes with the sense of empowerment, whether she could prescribe certain medications on her own. That I think has to be institutionalized. There should not be any governing body which comes and says that she cannot write so and so medicine. So I think that policy level empowerment of prescribing medications, including some high risk medications, also is going to be a part of a trend which I probably foresee. Of course, states like Orissa have pharmacists doing nursing course, and they're called as nurse pharmacists, right? So it is not that this is a very unique concept in India. It's already been done, I think, more than a decade back. And I think the third trend I see is less number of documentation. So all these AI-driven tools, analytics, technology-driven EMR, I think that is going to take the burden off from nurses, so that I think our highly specialized nurses could focus more on care, and I think lesser on the frills and fancies. I think this is something which in next immediate 5 years, I'm sure one of your hospitals I visited, they're already doing it. It's not something which is a different fantasy, distant fantasy.
Thank you so much, Dr. Samir. As you rightly said, specialty nurses, nurse practitioners, and they will transform the healthcare, how the care is being delivered, like in Western countries. Here too, we will definitely, many hospitals, though they have specialty nurses, they don't work in their full scope of services. They only assist the doctors. But as you said, if they are made to work independently, the hospital would be a better place, not only for the nurses, but not only for the patients, but also for the entire healthcare community. And you mentioned about the documentation. The documentation has to be less. How many of y'all in the and you also mentioned that AI will help in reducing the documentation. I'm also an NABH assessor, so whenever I go to various hospitals, the one most important thing they crib about is there's too much of documentation after this NABH, and the nurses spend a lot of time post duty also to, do this, complete this documentation. So, how many in the audience? What percentage in the audience feel that the technology will play a major role in shaping the future of nursing practice? Thank you. My next question would be to Brigadier Dr. Ramurthy Sharma, Medical Superintendent, Sharda Hospital, Greater Noida. Brigadier Sharma, I'd like you to throw some light on some of the effective ways to promote diversity, equity, and inclusion in the nursing profession, and how can we ensure that nurses reflect the population they serve? Over to you, sir.
Thank you. Hello. Thank you, Ms. Bobby. Hi, everyone. First of all, I would like to thank Voice of Healthcare for giving me this opportunity to be here in this panel discussion. I am Brigadier Dr. Ramurthy Sharma. Just to give you my brief background, I served for 34 years in the Indian Army. And for the last 4 years, I am working in Sharda Hospital, one of the largest hospitals in Greater Noida. So, the question, like what you asked me, the diversity, equity, and inclusion in nursing services. Like, diversity becoming more and more common nowadays in nursing profession. The kind of role they perform. If you look at the training, we get nurses trained from various places, various background. They come to various kind of training. They come. There are small nursing colleges. There are bigger nursing colleges. And like I would serve with the Indian Army, as I was telling earlier, in the Indian Army, we had all basically female nurses, and we used to call MNS services, military nursing services. By and large, they were all from around 70 to 80% from Kerala. All the nurses used to be from Kerala. And sometimes jokingly, we used to call it Malayalam nursing services. But now, things have changed. We get nurses from almost all parts of the country, almost equal distribution of gender, various training background. So this is diversity in training, the kind of training they undergo, kind of background they come, their religious diversity, their background, this is sectoral diversity. And about the roles they perform, the already discussed by Dr. Raminder and Dr. Sameer, the various kind of roles they perform. They are nurse practitioners, they are AI skilled nurses, they are having roles in telemedicine, they are in leadership roles, they are working like a CEO of the various hospitals. So they are diversifying in almost various roles in the healthcare, and which is helping the healthcare in a big way. So diversity is almost there in every field of the nursing, right from the training, from the work, and from their future perspective. About the equity, I will say equity is very, very important in that for the overall well-being and in the growth of the nursing profession. Whichever background they're coming or whatever role they are doing in the healthcare setup, whether it's a hospital or it's a community, we need to take care of them. Everybody has to be given equal opportunity for the growth and career development. There may be some marginalized section of the nurses, but it is very important for the leadership, for the healthcare leadership, for the nursing leadership to take care of them, so they all feel equal. They feel same thing about the inclusion. Inclusion, this basically means all should be equally feel as a part of the mainstream work of the organization. They are in the mainstream and they participate in almost every activity of the hospital, of the healthcare organization. About the community they serve, what kind of representation they can have for the community they are serving. I would like to say nurses should have more and more role in the community service. In our hospital, in Sharda Care Hospital, Sharda Hospital, we conduct large number of community outreach program, and I make sure they are the part of the community outreach program. They should go to the community and they should interact with the community, and so that people they are serving, community should realize, yes, nurses are the part of integral part of the healthcare services, and they're working for the people, they're working for the community. So not only that, they should take more and more role in community services. Nowadays, India is having the huge burden of community problem like lifestyle burden, disease, obesity, diabetes, hypertension, which also lead to renal failure. They should organize some kind of wellness camp or some kind of community teaching, coaching kind of camp, so that this kind of community problems are realized. Nowadays, patients do not want hospitalization. Nobody wants to get admitted in the hospital. They want short, very short hospitalization, and they want to go back to their home, their community, and they feel treatment should be given at home as much as possible. We try sometimes hard to get number of IPD beds. We try to struggle hard to maintain as per the NMC requirement, but patients do not want admission. I am from critical care background. Even in the ICU, the moment patient feel better, they want to go back to the community. And patient in the last stage of sometime life, they said we do not want the hospital care, ICU care. We want basically home care. Sometimes we set up the ICU at home, at the home care, which again, nurses has got a very big role in the ICU at home, or this kind of healthcare delivery in the community. They got a big role to play.
Thank you so much, Brigadier Sharma. As you rightly said, with the focus currently is on prevention of diseases, nurses play a very major role in community services. My next question would be to Neha Gupta, DGM Operations, Graphic Era Institute of Medical Sciences. Ms. Neha, how can we foster a culture of collaboration and teamwork between nurses and other healthcare professionals to enhance patient experience? Because patient experience is the need of the hour. Gone are the days when patients used to come to the hospital only for the treatment. Now, most of the patients who are coming to the hospital for a treatment, they are treated more like a customer. They expect the same treatment like how they get when they go to a hotel or a restaurant, or if they take a ticket in a premium economy or in a business class, this is the expectation of the services they have, apart from the treatment what they are provided with in the hospital. So they expect better services, they expect the standards of services to be much better than in previous days. So many hospitals have chief patient experience officers, patient experience executives department, and there's so much of importance given to patient experience. So considering that, how this collaboration between nurses and other healthcare professionals can enhance a patient experience.
Yeah.
Over to you.
Thank you, Bobby ma'am, and greetings from Dehradun Graphic Era Institute of Medical Sciences. Ma'am, I believe nursing is the neurons of the hospital. Okay. Currently, the personalized care plan, which is what all the hospitals work on. See, everyone will have a CT, MRI, ICU, state of the art ICU. Everyone would have, best of the doctors empaneled in the hospital. What makes a difference is the nursing care, uh, which is part of the first-hand patient experience throughout the hospital. Right. So, what is more important is that we need to collaborate more of our nursing professionals. And as Sir rightly said, that we would love to call them nursing practitioners officially, because they are at the ground level, and they interact with the patient at the point of care. So collaborating with them and building a culture of team playing, where nursing have a equal voice over how a treatment plan is possible for a particular patient. And that is really very important, and that is where I think that all hospitals should work on, because it makes a difference in a patient to patient interaction at a point of care.
So thank you, Ms. Neha. My next question would be to Dr. Sameer Singh. Dr. Sameer, what are some of the most significant challenges facing the nursing profession today, and how can we address them to ensure a strong, sustainable workforce for the future?
So I think thank you for the question again. This kind of sums it up what everybody has been saying and talking for years. I think the first challenge is the level of education and training which the present batch of nurses are getting. All of us as hospital administrators into operations definitely feel there's a big gap between the nurses which were produced, say, 7 years or maybe 5 years back, and the present lot of nurses. The focus is very much on patient care, and I think the technical finesse is gone. I have commissioned many hospitals. People with 2 years of experience are doing and of course skill-based mandatory training in a skill lab. No nursing colleges should be approved which do not have
Proper skill.
attachment to a skill lab, right? So I think that should be the criteria for the nurse which is sent to hospital. I think that will really change their impression. One. Second, I think, is participation. And of course, when I said is institutionalizing your nurse practitioners titles, your designations, having I think more empowerment, allowing them to take decisions, and all that is only going to happen when you also bring a large chunk of nurses into mainstream management. We were probably one of the first ones, I think, at Columbia Asia, which tried that model. Of course, somebody mentioned a nurse CEO of a large chain based out of Delhi. So we were the first ones who have tried it out. We have tried it in multiple units as unit heads. So I think if you do that, you're going to bring a nurse which brings in not just the management acumen, technical knowledge, not just the knowledge about projects, knowledge about operational flows. But what she will definitely bring is care, compassion, and patient centricity, which I don't think anybody else in this room can boast of apart from nurses, right? So I think that I have not seen an MBA in nursing services. I'm yet to see an MHA in nursing services. I think these specialty nurse practice driven management courses, it could be a year long, it could be a 2 year long courses. I think that will really change the healthcare game in India. I think that's my 2 penny worth of advice. Thank you.
Thank you, Dr. Samir. And Dr. Samir highlighted that nurses make better administrators, and in the previous organization, one of the nurse was promoted as a unit head who later became a group CEO for a group of hospitals in the country. While collaborating with other departments and being with the patient 24/7 and contributing maximum to the patient experience and outcomes, who better than a nurse can become a better administrator with the right amount of skills and knowledge and having an additional qualification on MBA or MHA. Just recently in the month of January, there was a AHPA global conclave wherein the patron, the Director General, Dr. Giridhar Gyani, mentioned that they are rolling out a one-year executive management program for nursing administrators or nursing professionals, which they have tied up with IAM Kozhikode or Calicut. Yeah, so nurses can do that, and that will help them step up in getting promotions into hospital operations and managing a hospital. Yeah. Now, we hear a lot about burnout of healthcare professionals, especially during COVID. Now, burnout among healthcare professional and mostly among nurses, because it's a very high level stress job. So nurses face a lot of stress and burnout at their workplace. So my question would be to Brigadier Sharma, what strategies can be implemented to address the mental health and well-being of nursing professionals who often face high levels of stress and burnout?
Very good question and a very relevant question. Stress leading to burnout is really a common issue in the nursing profession. I myself have seen many of them, they feel a lot of stress because of work-related issue. Small mistakes are highlighted by the other healthcare providers, even sometimes hospital management. They are targeted at times, which leads to high level of stress. So first I find few points I think which should be done to take care of the stress. Work-life balance, equal time for work and balancing. Work-life balance is very important for the nurses to take care of themselves so that they do not work for a very long hours. Many times there is shortage of nurses in the hospital. Some of them resigned and they are put on extra duties. In fact, I face sometimes in my hospital, there is shortage of nurses in the ICU. Shortage of nurses. ICU work is huge. It can generate huge amount of stress. Patients are very sick. Many of them patients do die also. And when they are doing long duties in the ICU, it puts huge amount of stress on them. So it is very important to have adequate nurse-patient balance ratio in the hospital so that for equal hours, number of time, equal hours, and not much of stress on them. And we should take care of the personal comforts also, kind of accommodation they are staying, kind of nutrition, kind of food, their personal requirement should be taken care by the hospital management and by the hospital leadership. So that is one, work-life balance. Second important issue which can be done is the basically posting mentorship program, like what is we are doing in a medical education. NMC has made it a mandatory for mentor-mentee program for a medical student from the MBBS day, from day one. We start mentor-mentee program for a medical student. So they are taken care of. Same way can be done for the nurses, for the nursing education. And when a young nurse join after doing her GNM or BSc nursing, they join, they are vulnerable. The young nurses, maybe boy or girl, they are vulnerable. They need to have mentors in the hospital, maybe senior nurses, other healthcare professional can be their mentors to take care of them in the initial part of their profession, initial part of their career, so that they do not feel stressed out. That is the career development program. Everybody wants to enhance their career. They want progress in their career. So they should give an equal opportunity for the career enhancement. They want to go for higher education. They want to go for specialty courses. That should be provided to them. Career enhancement is very important for the job satisfaction. Good salary to the nurses is another very important part. Generally, I find their salary is not adequate to their qualifications, and the salary or financial reward is also very important for part for the their satisfaction for their well-being. And the point I want to say, the tailor-made maybe some kind of mental health program can be designed for the nurses who feel outstanding with the help of secretary department, with the help of community medicine department. We can design specific kind of program who can take care of the stress, and like something like yoga, meditation, and some kind of sports, cultural activities can be planned for them so that stress level remains under control. Thank you.
So thank you, Dr. Sharma. As you rightly mentioned, a mentor program, or having good mentors for these junior nurses will help relieve lots of stress. If you have good mentors and preceptors, that helps. Salary is another point. Diet. Apart from that, I also feel other activities have to be conducted in the hospitals to relieve stress, and also for taking a break in between. Many hospitals have lounges for the doctors. Very few hospitals, our hospital have lounges for the nurses in every floor, but most of the hospitals do not have. So it should be made mandate, like for other healthcare professional, when they have lounges, they need to have lounges for the nurses as well. I hope the esteemed panelists will agree to that. So when you're building itself, please have some lounges for the nurses as well, so they don't feel so stressed out, or if they are so much exhausted, they can take a small break. In our hospital, we have a break, we have alarm, we keep every 2 hours for the nurses to take adequate water, because many of them, because of not taking water, they end up with urinary tract infection, fever, everything. So at the beginning of every shift, it is mandate for them to drink a glass of water, and also in between every 2 hours we keep an alarm for drinking water. So like small things like that definitely help relieve a lot of stress among the nurses. My next question would be to Ms. Viji Verghese, Hospital Director, Manipal Health Enterprises. Ms. Viji, as the demand for healthcare continues to rise, what strategies can be implemented to attract and retain skilled nurses, ensuring they are empowered to meet the challenges of the future?
Nursing shortage is a global phenomenon. Across the globe, this issue is there, and not only in India. In India, there is a peculiar situation because though we are producing nurses, a lot of nurses migrate, and also there is a lot of rural-urban imbalance, so inequality in distribution of nurses also. So I believe to retain nurses, some of the points we have already discussed about a work-life balance, adequate compensation, and we also talked about a better working environment and a balanced workload. So basically, these are very important for the nurses to continue working, and so that we can retain our nurses. And I also believe that the culture of the organization is very important. When I talk about culture, it's also about recognizing the contribution of nurses and also giving them some career pathways so that nurses can progress in their career. So we, some of the esteemed panelists mentioned about nurses taking up senior management or leadership roles. So as an organization, we should be able to, like Dr. Sameer has mentioned, how the organization has given opportunities for nurses to come forward and even go beyond the nursing department and take up bigger roles. So these are very important. To summarize, I would say 3 R's. R means R, one is respect, recognition, and rewards. So these are the three, this is the main strategy for retaining our nursing workforce.
That's great, Ms. Viji. 3 R's, please do remember: respect, recognition, and rewards to retain the nurses. Thank you so much. And over to Ms. Neha Gupta. What are some of the KPIs or key performance indicators that nursing professionals can use to measure the quality and effectiveness of their care And how can we use those data in driving improvements in patient outcomes?
Thank you for this question, Ms. Bobby. See, we've been doing NABH accreditations, JCI accreditations at our hospitals, and we function on, different KPIs like medication errors conducting. Then, we also do other scoring mechanisms in the ICU and all. Apart from those KPIs, it's very important to build a collaborative culture within the hospital, that the nursing is involved in KPIs like SABR ratios, which are, taking in account what is the situation, background, and assess it and recommend, future plan on that particular treatment course. So that is my recommendation, on the panel, because we all are aware about the different KPIs which run throughout the hospitals in different, I'll give you one example. Like there's a study from John Hopkins Institute that, there were a lot of hospital falls during a particular, time zone in the hospital, a matter of 2 months. And they studied it, and they found out, that during the night times, night rounds, the nursing manpower was decreased due to certain short staffing. And just by identifying that one parameter, by taking those high risk patient a day, an early round of during the nursing rounds in the night, they could reduce the hospital fall risk by more than 40%. So we need to see, we are collecting a lot of data, but who is analyzing it? So we need to ask our nurses to be a part of that analysis also. That is what SBAR scores are. So that is one of the KPIs which I would recommend to all hospitals to adopt, is during other than the normal medication errors and stuff like that which goes around in the NABH audits.
Thank you, Ms. Neha. Dr. Kalra, how can we redesign nursing education and training programs to prepare nurses for the complexities of modern healthcare and the evolving needs of the patients?
Thank you so much. And I would just like to take some points from the previous speakers also before I speak on that. One thing you said, the standard of nursing education. Whether you talk about nursing colleges or medical colleges, we know the standards have gone down in many. And there are colleges who are very looking when I come to my college anytime, have surprise inspection, have any problem, talk to a customer. Very important is to maintain the standards of nursing education. Often happens that till the time the nursing professionals are empowered, you have the power to de-recognize it. There are lot of political pressures and all which go on. We know, I have been inspected to many colleges, and re-recognized for some time, somebody else goes after 3-4 months. There's a lot of political pressure. There are a lot of issues which need to be taken care of. Now we have National Nursing and Midwifery Commission Act which is passed, and soon INC will be taken over. And when that comes, we have exit exam, and that recommended exit exam. When you have exit exam, especially skill based, then you will not be able to get the registration without qualifying that exam. And that's the way, even in the foreign countries, they are able to maintain the standard. That will be definitely of. And as Dr. Ramurthy was talking about, mentor-mentee program that is existing in the nursing colleges also, and we do take care of. You were mentioning about the burnout and all. There are, many hospitals, many institutions have come with the psychiatric mental health nursing getting together, and there are recognized, services for any healthcare professional. When they have any stress, they can go. These people will take care of. So these things are coming up. Now coming to the question you asked about the future of nursing, that how do we look into. With the new things which are coming up, the nurses are going to take up a lot of important roles. Nursing education, they presently the problem which we are facing is sometimes the courses are not being revised for so long, so we are not able to update according to the need. Certain colleges may add certain things on their own, but overall it may not be happening. I believe that in nursing education, you should give a scope of flexibility. These things to be added into the curriculum, and then look into, give them the time to have their thinking also being involved, not keeping them so much occupied with the assignments and other things that they don't get time to have their thinking being stimulated by more of problem based and other projects. Anything else which is left unanswered from your question?
No, thank you so much. And
Thank you.
like MCI, NMC, NNMC is going to come, and that answers the recommendation by Dr. Samir in the previous round, who mentioned that there should be standardized education. At least if there is a standardized exit exam, skill based, definitely that will make the nurses who are joining the hospitals more competent.
There's also a need of having directorate of nursing in each state. Right now we have only in West Bengal, others are still working on it. Unless you empower them at that level, many decisions, many files are left like that. Lot of nursing colleges, government nursing colleges, who are running with shortage of faculty, or with the people being shifted from the hospital side to the college to take care of, who do not take so much of interest. None of the government colleges in Delhi are having the principal post being filled for decades. Very sorry state of affairs.
Thank you, Dr. Kalra. My last question would be to Ms. Vijay Varghese. How can nursing professionals take on leadership roles in shaping healthcare policy and advocacy efforts to improve patient care and outcomes?
See, as a trained nurse myself, and as a person who has been fortunate enough to take up very senior leadership roles in organization, including United Nations, and currently heading a 400-bed hospital. It's my privilege to just share this experience of how nurses should be given the opportunity to take up senior leadership roles. See, by virtue of the nursing training itself, nurses are trained to look into patient and healthcare outcomes, which is the core of the entire health service delivery. When we talk about health service delivery, we are looking at better patient outcomes. And who better than a nurse knows how to define, how to control, how to make sure that patient quality of care is maintained, patient safety is maintained, and the overall better patient outcomes can be delivered. Just before starting this session, there was a mention of Florence Nightingale, who is the pioneer, the founder of modern nursing. All of us know about that. But how many of us actually know that Miss is the first hospital designer who talked about a nursing unit or a hospital, a ward or a hospital, wherever organized. So that itself shows that nurses are the leaders and they know about what we are talking about when it comes to health service delivery. And one more point I just wanted to highlight, which may not be getting that much importance, like nurses, when it comes to access to healthcare. There are so many centers in community health, whether it is school health or even community centers or even retail clinics, which are entirely managed by a nurse. So she's handling the entire, though it may be a small setup, but she's making all decisions. Some of the panelists talked about nurse practitioners. It is nothing but an empowered nurse who is making clinical decisions. So any senior leadership role is all about making decisions. So that is why I believe that nurses are really trained to to take this kind of roles. So before, one more point I just wanted to highlight is the entire healthcare system. 80% of the workforce is from nursing professional. So who else will understand the how the personnel needs to be managed to deliver better healthcare than a nurse herself or himself? I just want to conclude, ma'am, just with one point. But unfortunately, many a times nurses are not coming forward to take up such senior roles. And there are two reasons that I am seeing. One is about the environment. The entire healthcare environment is still a little bit biased. It's a little bit hierarchy based. There are certain age old power dynamics which is still going on within the healthcare system, which is not giving, I mean, I'm sounding a little negative, but I would say it's not giving the appropriate opportunities for nurses to come forward and take very senior leadership roles. There is also a little bit personal reluctance that I'm seeing with some of the nurses because of, maybe because of lack of that kind of confidence, or maybe sometimes lack of the correct skills that is required to take senior leadership roles. I'll share my example. I got the courage to take up that because immediately after my graduation in nursing, I did my master's in hospital administration from Tata Institute, and that has given me personally, I'm just sharing, the courage and the confidence to take up such roles. So I believe that nurses are the most appropriate person to take up these roles, and with the correct environmental support within the health sector, I'm sure more and more nurses will come forward and take up very senior leadership roles. Thank you, ma'am.
Thank you, Ms. Viji, for rightly pointing out there are challenges from both ends because of the traditional hierarchy system in our country and also the hesitance from the nursing community as well. So both can be worked out, and some of the hospitals have already come up with leadership courses. They are sponsoring their nurses for going in for leadership courses from Tata Institute or ISB and then absorbing them into operational roles. More hospitals can follow that. So with this, we come to the end of our panel discussion. Thank you so much to our wonderful panelists for sharing your insights on the expertise today on nursing in the spotlight, shaping the future of healthcare delivery. We have covered a lot on ground, from the evolving responsibilities of nurses to the innovative solutions shaping the future of healthcare. To echo Virginia Henderson's powerful words, the nurse is temporarily the consciousness of the unconscious, the love of life for the suicidal, the leg of the amputee, the eyes of the newly blind. It's clear that nursing is not just in the spotlight, but at the forefront of healthcare's transformation. I'd also like to thank all of you, all the audience, for your wonderful participation. Let's carry this momentum forward as we continue to support and elevate the vital work of nurses everywhere. Thank you so much. Last but not the least, I'd like to take this opportunity to thank the organizers of Voice of Healthcare, Dr. Naveen Nishal, Pinky Chahar, and all the team members of Voice of Healthcare for giving us this opportunity and having included a session exclusively for nursing. And one thing I wanted to mention here, Dr. Samir was mentioning about one of his colleagues asking, what are you going to do in the nursing panel? Thank you so much, all of you, for participating in the panel on nursing. We have medical directors. Two of them are medical directors. One is a hardcore academician in nursing. One is a nurse turned hospital director, and another one is into operations. So it is it's a fantastic panel. Thank you so much for joining in spite of your busy schedule and contributing to the discussion. Thank you so much. Have a good evening. Thank you.
Very rightly said, ma'am. It was a fantastic panel and it was excellently moderated by you. This was an impactful session. I believe our audience would agree with this. I think we got some really good insights, expertise, and experience which the panelists have. So it ended up very, very well. So thank you so much, all the panelists, for sharing your expertise with us. Now it's time to felicitate our panelists for their great panel discussion. I request Ms. Bobby Ramesh to please felicitate Dr. Sameer Singh. Dr. Raminder Kalra. Miss Viji Varghese. Brigadier Dr. Ram Murthy Sharma. Miss Neha Gupta. And now I would like to invite Dr. Naveen Nishal to please come on stage and felicitate our moderator, Ms. Bobby Ramesh, for leading this insightful discussion. I request all the panelists to please come on center for a group picture. Thank you, everyone. Ladies and gentlemen, as we reach the grand